All right, so I've got Stacey Boetto here today, and we're going to talk about healthcare. Stacey, you're a nurse practitioner, correct?
Correct.
Now, I think that most people understand what that is, but let's just kind of explain it. You can prescribe drugs.
Correct.
Um, you're like the people can come see a nurse practitioner and forego the doctor's appointment, correct? Like they can
Correct.
just see you and be like, all right, I have the flu. You can, do whatever you need to do to get that done.
Yeah.
Um, where like a regular nurse is not, on our end, is just not gonna, they can't prescribe drugs. They can't
Correct.
see someone on their own, sort of a thing like that.
Right.
So now, how long did it take you to get to that point? What's the education background there?
Yep. So I have a master's degree in nursing,
Right.
and I have my family nurse practitioner certification. You have to be board certified, so you get your BSN, and then you go on to get your master's in nursing. You can be a doctorate in nursing
Right.
as well, but I don't need to have that end degree. I don't feel it. I know a lot of people joke and say I'm still going to go on, but I won't.
That's like a weird thing, right? To have a doctorate in nursing.
Right, right.
If
Everybody's
you're,
like,
I think if you're on the education end, then you'd want that, right? Like if you're going to teach, then a doctorate, like a PhD, would be the deal.
not necessarily.
Oh no.
You can have your certification in education is what you need to teach.
Okay.
But you do have to have a certification in education. Yeah.
Oh, okay,
Yeah.
okay,
Yeah.
all right.
Yeah.
Yeah, I mean, I was a guy that pretty much after high school was right to construction, and
Yeah.
that's how it went. But
Nothing wrong with
um,
that.
no, 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 no.
No.
And I like to, like for my own kids, I set the bar high. They're all looking to get postgraduate degrees and stuff
Yeah.
like that. But if they don't, I mean, my sons have been doing carpentry since they were 12.
Right.
They can go right into the trades if they'd like to.
Yeah.
But for a guy that broke his neck, I don't want them in those positions. I'd like
Right.
them to, and I mean, anything can happen. You in a car wreck and break your neck.
Absolutely.
But I also see a lot of guys in the trades that they get old fast. The
Absolutely.
sun beats the shit out of you, the weather beats the shit out of you, and then just the labor job
Yes.
beats the crap out of you. When I was younger, in my 20s, it was nice to have a trade job because I would go places. Like I'd go to Canada with a bunch of guys that worked at Xerox, and I was amazed at how bad of shape they were in. I'm like, oh my
Very
God,
quickly.
how do you function behind a desk? Like, pick up a dumbbell for God's sakes.
Yeah.
But so I want to have a conversation about healthcare, and I want to be the podcast thing is fun for me because it could be deep dive. So like, there's no rabbit hole you're gonna go down that I'm like, let's get back on to. It doesn't like there's all kinds of things that go on, and like I was explaining before the podcast, I spent a lot of time, in the healthcare system, right? I spent
Yeah.
4 months in a rehab hospital, and like I live a different life now than I did before my injury. Before my injury, I never broke anything except for my hand one time on a guy's head, and I didn't go to the doctor for that. Like I just pretty much wrapped that up and went, on my way, and I have a broken bone in my hand, and it is what it is.
Body tape it.
Yep, I just was like, whatever.
Yeah.
And I mean, we did all kinds of like, I'd cut myself and do the butterfly stitches.
Super
And,
glue it.
yeah,
Yeah.
whatever the hell. I'm not going to the doctor for anything.
We didn't.
No, right. But now, after the injury, like I go just for precautionary things. Like
Correct.
once a year, I'm at the urologist. I don't have any trouble in that department as far as like I had some kidney stones at one time, but oh yeah, no, for a guy in a chair, that's kind of a thing. Like
Yeah.
that's a thing that happens. But as long as you take care of yourself and you get the right information, which you get from the doctor or a nurse practitioner, then you can make everything all right. But like if I get a kidney stone, I can't pass it.
Right.
So I had to have my back cut open the one time they take the kidney stone out of my kidney.
Yeah.
So, I go once a year, they do an ultrasound. I need to see if I got any kidney stones or anything like that building
Right.
up. Take a urine test and everything's good, then I'm out of there. And then if anything goes on neurologically, if I have something that all of a sudden is, I had a real weird thing where my left arm like was lifting on its own. Like,
Oh.
I don't know what was going on. My left arm kept picking up like on it. Like I'd have to like, it was almost like a yawn. Like it would just do it. And I'm like, it's killing me. But it sounds my phone. So anyways, I was in for an MRI, get checked out, all that kind of stuff. And um, so I'm in the healthcare system a lot. And
Right.
then I dated somebody for quite a while who is a PT at the biggest rehab hospital in the country. And her job pretty much too big of a portion of our job is writing medical necessity, letters of medical necessity.
Sure.
And so like I'm pretty familiar with like HIPAA and like anything you talk about. Obviously, you can't give enough details where someone could figure out who it was because it's
Right.
going to be a violation of their privacy, which that's perfectly fine by me. But our medical system in this country is screwed up, and for me, part of what's screwed up about it is the propaganda that's on the news about it. People believe things that are just patently false about what goes on. So to have somebody that's in your position actually explain, that's really not correct. I mean, I had a conversation with someone, and I love a contested conversation where someone doesn't understand what I'm saying or doesn't believe what I believe or whatever like that, because then we can talk about facts and then maybe we can get to a point where we talk about solutions. Some people get really upset if you don't agree with them.
Absolutely.
I don't. I don't ever get upset. I actually gravitate towards somebody who doesn't, like agree with me, because then we can actually have a meaningful conversation. The conversation I don't want to have is I say something that someone's like, yeah, like that's lame. That's a boring time to have a conversation. So, the medical, for me, I don't see a solution to go all the way to the end of the podcast other than some sort of single payer system where we do what all of the other industrialized countries in the world have done to make it. When you have a single payer system, you take out that middleman first of the insurance CEO guy. I've had people that go right to, when I say that, they go, well, what about everyone that has a job in the insurance industry? And I'm like, well, everyone that has a job in the industry actually does a job. That job's still needed. You still need claims writers. You still need, underwriters. You still need people that process your claim. You still need all of the other things that you need. You just don't need the guy that makes the profits on the industry.
What is he doing?
I don't know what he's doing.
Right.
But then again,
none of us do.
Right. I don't know what most CEOs do. I mean, I don't think that the CEO of McDonald's who makes, 30, 40, 50 million dollars, whatever he makes a year, came up with pop, 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 pop. I'm loving it. I don't think he came up with that, but he's getting paid, through the nose. So, I don't know. But for me, that middleman needs to be cut out. And then the other thing you do in a single payer system is you have a single payer. So when the hospital says, we need $18 for these 2 Tylenols to be administered to this person, the single payer says, well, no. We understand that it's a hospital, it's going to cost more. We'll give you $3 to administer, and that includes the acute nurse to show up with the cup and give them the thing. But that's all. That's all we're going to pay. And the hospital has no recourse to change anything. What they have to do, and you would know this but way better than me, but from what I know from people on the inside, hospitals have a overhead that's bloated from there's too much administrators, too many people with VP titles sitting on their desks that are, again, aren't doing a job. Now, when you go from an $18 set of aspirins to a $3 set of aspirins, right away the hospital goes, we're going to have to trim some fat. We're going to have to figure this out. And maybe Nancy with her VP job sitting there is going to have to go. Yeah. So, that's what's going to have to happen. And for everyone who works for a living like you do, I don't think anyone's upset about that. Nancy's going to have to go get a job now. A real job. If she wants to have one. The woman that I dated, there were some people in VP positions there that held those positions. They didn't even have an office at the hospital. They had an office in another building. They're really just wealthy people that wanted to have a part of this, like a prestigious, they wanted to be at ribbon cuttings, right, in a title that they had. So when they're at the cocktail party, they can say, well, I'm the VP of blah, 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 at so-and-so building and stuff like that. Well, really, they're just trust fund kids that have a ton of money. We as the middle class don't need that in our healthcare system. So let's get rid of that. And then the other problem that I have with the healthcare system in our country, which I hope doesn't, but I think is going to come to a head in this country real soon with this coronavirus situation going on, or a virus like that, or any kind of thing like that, is we in this country, and guys are the worst at it, procrastinate on going to seek medical care for anything. I'm telling you, if I get a cold, I'm not going to unless blood is coming out of my ass, I'm not going to the doctor.
It's a virus, first off.
Right. And I'm not,
I mean, there's a time. It's education. It really is.
Right. But the hysteria with this is definitely silly.
Exactly.
But if you had something that so you got two sides of a coin with that, right? The hysteria silly.
Media provoked.
Right. Totally nonsense.
Exactly.
But the reaction from the orange buffoon in office of it's just a cold, it's not just a cold.
It's a virus.
Right.
It's
They're saying that the mortality rate with it is 3%, and they keep comparing it to the flu, so much so that the orange buffoon said, "Could we just use the flu virus, flu vaccine?"
the flu vaccine.
And the person there was like, "No." And he goes, "You don't think it would do?" And he challenged him on it. He's like, "You don't think it would help at all?" And he goes, "It would do nothing. It's not designed like it does. This is not how this. What was the Geico commercial? This isn't how this works. This isn't how any of this works. That's not how vaccines work."
This is somebody who has no medical knowledge, no medical background,
Right.
trying to tell somebody in medicine
Who does, right?
how to practice, or a scientist who studies medicine of
Right.
how to
Right.
how to come up with a vaccine to help those in medicine to treat or
Sure.
to do something like that. So yeah, I kind of laugh. So the coronavirus, I mean, it's out of proportion right now. This is just
For sure.
out of proportion. The flu is, okay, so in 4 months, October 1st to February 2020. So the flu virus killed, what was it, 46,000 people, okay?
Right.
It affected about 32 to 46 million people. Coronavirus, as of today, I looked it up on the CDC, I looked it up today, I think there are, 10 deaths and 19 cases. So do the math, people. Do the math.
So the numbers I saw were the 10 deaths, but I saw 155 cases today.
I looked it up today. I don't know.
No, I saw 150.
In U.S.
Oh, in U.S.
In
No,
U.S.
No, in U.S. No, there's 2,000 deaths globally. China's got a whole mess.
But I'm talking about U.S.
No,
just
I'm
right
talking
now.
about U.S. only too.
Yeah.
The cases were 150 cases with 10 deaths.
Oh,
Now,
okay.
if you do the percentage math, that's about 4 or 5% dying from it.
Right.
The CDC also released something that I read that said that unchecked, if we don't do the right thing for this, like get the testing kits and all this other stuff done, that the contagious level of this coronavirus, this strand of the coronavirus too,
Which changes.
right?
And there's multiple.
That's the thing that drives me nuts.
Alpha, beta, delta, and something else. There's like 4 different. Again, like the flu, it switches. So,
Well, whatever it is, the COVID-19 that they're
COVID-19.
COVID-19 that they're talking about, if it was unchecked, some of the issue with it is that they're saying, because they're like sanitizing the subway and stuff like that, because they're saying that it lives outside of a host for longer than the flu. So they're saying that the level of contagious with this is more contagious than the flu. The CDC released a number that said it's very feasible. What do they say first off? It's not if we have an outbreak in this country, it's when. And if we have an outbreak in this country, it's feasible that 40% of the population over time, not once or in a year, could be infected with this. I think that's similar to the flu, like as far as 40% of the population could get the flu over a couple of years. But at a 3% mortality rate, if 40% of the population gets this, you're talking about 120 million people, and 3% of that's about 5 million people dying. So it's definitely, if you're talking about 30 times the mortality rate than the flu, it's something we need to take precaution about. It's certainly something, I think Trump today said, go ahead and go to work with it. No, don't do that.
Stay home if you're sick.
Stay home if you're sick.
It's the same thing. It's the same exact thing.
Right.
So it's a virus. There's no medication to treat it.
Right.
Okay. You can't give an antibiotic for a virus.
Right.
And that's the thing that I tell when patients, come into me like, well, I have a cold. Yeah, it's a cold. Well, I need an antibiotic. No, I can give you every antibiotic in the book, and unless it's bacterial, nothing is going to help this. So
bacteria are antibiotics to cure infections.
Right.
It's like a bacterial sort of thing. So you need to understand that too. And then the one that I see, social media is a haven for dumb. It really is. There's some of the dumbest things. The one that I like the least because it's so dumb is the Lysol bottle that they keep posting on the thing. And first off, I don't know if you're planning on eating the Lysol.
Spray it.
Right.
Like Banaka? Isn't that what we used to use in school?
Right. The lemon flavor is going to be wonderful, I'm
Yes.
sure. But secondly, they're like, how come if it's new, is it on my... Well, Corona
It's
is
not
not
new.
new, but the COVID-19
COVID-19
is
is the
new.
newer one.
And that's the problem. And then every time that a virus mutates, the old vaccine for it or whatever went
Just
on,
like the flu.
it's no good no more.
Right.
So the common cold, the one that they're like, we're never going to cure it because it just
No.
keeps morphing and morphing and
The
morphing.
rhinovirus, yeah.
Right. So people see that, and I posted the other because I like to poke people a little bit.
No.
That everybody who couldn't pass a biology class is now an expert on infectious disease because the orange buffoon is out there at a rally saying it's nothing, it's a hoax. It's a hoax. Listen, if Donald Trump was still on the fake set of The Apprentice and he was saying it was a hoax, that'd be one thing. But you're literally the leader of the free world. You're not supposed to do that.
No.
Like, your husband's a fireman. I'm sure there's all kinds of safety precautions that they go through just to make sure that it's safe. Now, probably everything that he does doesn't need to be done every single time because it's an overkill.
Right.
But you still need to do it every time because then it's safe,
Right.
sort of thing. So even though it's not as a hysterical situation as the media is making it out to be, you still need to take every precaution.
Wash
you
your
still
hands.
wash your hands.
Cover your mouth.
I mean, I made a joke when you guys came over. We fist bumping because of the
Yes.
virus.
Yeah.
Right now I've got a friend who is in Vancouver, which is the closest airport
Yes.
to China, and she's a little worried. She's like, hey, everybody here is wearing a mask. And first off, that's another misconception. The mask is actually, they're saying, a thing that's a moist, actual virus-friendly environment, so probably not a good thing to do.
N95 is the one.
Yeah, there's only like one mask.
And then I love when I see them wearing it down here.
Right.
I'm like, okay, that's great. That's
It's not
awesome.
over your
My other
nose.
favorite is the one where I see them wearing the dust masks, which are the ones that you probably
Yeah,
used
for
during,
work.
Right. I'm like, okay, you're getting this at Home Depot.
Right. Well, I've
Godspeed.
seen people that, what they said, Gwyneth Paltrow had like just a scarf that she
Yeah.
wore over her face, and I'm like, what?
I mean, at least it's something, but,
Right.
you know.
And the other issue that I take with it too is people are like, I'm young and healthy, it's not going to, well, okay.
Yes and no.
Yes and no. And secondly, I don't know if the I have mine Jack approach to this is probably the one that's going to, like, you do have neighbors and people you care about. I'm sure somebody in your family is older or compromised.
I am. I'm on immunocompromised. I have medication
There you go.
that
Right.
knocks
And
my immunity out.
And that's
So-
tough for you because you're working in a in the healthcare industry where people come when they're sick.
I have patients come see me all the time that are sick. They
Right.
are, and sometimes they're with things that are highly contagious.
Right.
But
So the healthcare system to me in this country promotes a situation where people are like, I'm not going to go to the doctor. It's going to cost me too much, first off. And then there's people out there right now that have two conditions. You have, let's just pick two, a heart condition and diabetes, and they're foregoing the diabetic medicine because the heart condition is going to kill them first. So they're spending their money on because it's costing so much to get their heart pills.
Right.
But like the one woman I saw, she said that I have a 13% chance of my heart failing. The diabetes will kill me in the long run, but I've got to take the heart pills. So they're choosing between that. I'm certain that I'm a guy who would get a cold and not go to the doctor right away. And I won't say that I'm compromised because I for a guy in a chair, I'm extremely healthy. But like I haven't had a cold in over 12 years now. Like nothing. Like I just don't get sick. And I mean,
Sure.
I coach kids. I mean, they're picking their nose and touching my wheelchair. Like, it's I'm right there with boogers and shit.
Yeah.
So,
let
but
me
I,
touch it. Let me
yeah,
touch it.
right. I don't get sick. Oh my
That's
God.
how you're building your immunity. Right
Every
there.
kid in the world touches my wheels too. Every kid's like, I got it. I mean, little ones want to move me. But, so yeah, right. But I have I'm paralyzed in a way that like it's high enough that my diaphragm
Right.
doesn't, I use about 30% of my intake of breath.
Exactly.
So like I do things on the regular to forego pneumonia. So like I do controlled breathing exercises and stuff like that to make sure that I'm taking as deep a breath as I
Right.
can. So I'm doing everything I can. But there's other guys in chairs that are not. There's other guys in chairs that are just really getting fat. They're watching TV. They're sitting around. They're feeling bad for themselves. And I mean, they've got something to feel bad about, but now their health is compromised in a way. So the problem with a virus is if people get it, they don't get tested.
Correct.
Now you're a contagious person walking around giving it to everybody else.
Right. You could be the carrier.
This is a recipe for a bad situation in this country.
How many patients or how many people have you affected that you came in contact with?
Correct.
And it's what, 10 to 14 days before the symptoms start to show up.
Right.
And the symptoms are cough, fever, and oh gosh,
Vomiting, I thought, was one of them.
cough, fever, and now I just lost it. Oh my gosh, how silly am I? That looks really bad on me. But anyways,
Right.
I've had a little wine.
I thought it was flu-like symptoms.
It's the cough, fever, and oh gosh, I can't think of it.
Is there a
now.
headache, or is there what else is going on?
It's kind of like, I mean, it's kind of like a regular like cough, fever, and oh my gosh, now I feel so
Mental
silly.
like no.
It is. I gotta put the wine away. But it is very similar to like just a regular like, do I have a cold or do I have something more going on? So
Right.
that's the thing, you know. It's like an RSV. You know, is this the flu? Is this corona? Is this do I just sit home? Do I?
Right.
If you're sick, stay home.
Stay
The best
isolated.
thing,
I mean, the lady in New York, the lawyer in New York that has it, she isolated herself. She like locked
Perfect.
herself in an apartment. That was it. She still managed to infect 3 or 4 people though.
And didn't because she probably had it and didn't realize
Didn't
it,
realize it,
and
right.
that's the thing.
Right. And I mean, I don't know what the numbers are in Illinois right now, but 2 days ago it was 4
Yeah.
cases in Illinois.
One is sitting at home, and her husband's in the hospital. Is the last I heard
Right,
of that one.
right.
That was the last 2.
So some of the problem with the general public is they are math challenged. But if you take 40% of the population and then do a 3% mortality rate, that means 3% of people are going to die that are infected with it, and you have 120 million people that have it, you're going to have 3.6 million people die. That is significant. That's 1% of the population dying from something that if we take every precaution, you can save some lives, sort of thing. So when someone says something like 46,000 people died of the flu, okay, that's something.
That was in 4 months.
Right.
That was in 4 months, and that's not everything's reported, because they don't report all of the flu deaths, all of the flu.
Sure.
They don't. The
You're
CDC
pulled up
doesn't.
nowhere, right?
Well, yeah, and the CDC doesn't get everything reported. That's the problem, because not all the flu illnesses and not all the flu hospitalizations and all the flu deaths are reported. So but that was just in 4 months, though. That's 4 months from October 1st until February 2nd, I think it was, of this year. So
Right.
that's still not the full
Sure.
2020 yet. So
Right.
that's just 4 months worth.
And that's still only like a tenth of, not even. That's a hundredth of 3.6 million people dying. Like it's quite a different number if we do have a serious situation. And my issue with it is, if you live in a country like Denmark or Germany or any industrialized country that's got socialized medicine, the minute you're sick, you go to the doctor, because it's not going to cost you anything. You go in there and they get something, get tested at least to know you have that or not that, and then get on the path where you're first not infecting people, and then secondly treating whatever you have going on to try and make sure, if it's a respiratory situation that you're going to die from, then at least you can do the right things to try and keep your respiratory system in as best shape as you can. You have a better chance of living, sort of thing. So, yeah, to me, it's upsetting that leadership seems to be more concerned about the stock market than they are the actual outbreak, that sort of thing.
And I also think, though, too, if you go back to our system is broken, period. That's just coming from the inside of me.
Right.
Looking back of growing up with my family, growing up in the healthcare system alone, just seeing how my patients were. So growing up here in Illinois, then going to Missouri, living there for 6 years, going to nursing, starting nursing school in Missouri, and then working as a nurse there, then transitioning, going to Waco, Texas, working as a nurse, then Lafayette, Indiana, and then coming back here in 2009. So I have been in multiple states, multiple rural areas.
Was it vastly different from area to area?
Absolutely, because
Okay.
I was in rural, I was in towns, cities. So
Our country's huge. It is crazy that, if you travel to Florida, it's another planet compared to Chicago.
different.
Yes.
Whole
I mean,
different.
just the people in general. I mean, one of my favorite things to do is look up the police blotter for Florida.
Oh my
It's
gosh.
hilarious shit that goes
Yes.
on there.
Yeah.
But yeah, okay, so explain, like, how is it
Well,
so different?
it's funny because, my family transplanted, like my grandparents, they went down and visited. My aunt moved down, kind of the thing, they're Southsiders, right?
Okay.
So they decide, okay, we're going to go down to Missouri because, well, they decide they're going to visit my aunt, and then they decide, we're kind of tired of being in the South Side. This is kind of nice down here, and
Yeah.
that's how that happens. So then when I'm 7, we start going down there every summer.
Mm-hmm.
So I'm down there a lot and doing that, and I love it. So then I end up going to Southeast Missouri State University and, SEMO.
I have
So-
family in Missouri.
Yeah,
It's a
Cape
beautiful,
Girardeau. Yeah.
beautiful area
Yeah,
down there and
awesome.
everything else. I mean,
Love it.
I plan on retiring Tennessee, Kentucky, something like that.
I didn't want to leave.
Right.
So I and that's my goal too, is at some point when Jeff gets to the point where he can retire, that is our goal sometime to
Sure.
get a place. Tennessee or somewhere that does not tax his pension.
There you go. Right.
Because at some point Illinois is going to tax his pension. But
I wouldn't doubt it.
I digress. Anyways, it was funny because the first thing that they would say is, you ain't from around these parts. No, I'm not. What was your first clue?
The first clue would be I don't say things like you ain't from around these parts.
And ruins, I'd say use guys and, just the different things that I would say. And they're
Right.
like, she ain't from around these parts. And I'm like, no, I'm not. But it was kind of funny because just the different mentality, people would not come to the hospital until they were almost dying. And I started out, I've been a nurse for 25 years. I started out in a specialty, cardiac ICU, straight out of nursing school. When you did not start out into a specialty, I was very lucky and I loved it. But the thing is they would not come in. And these were people who were very, very sick. And their mentality was, we don't get healthcare. We just deal with our problems. Well, yeah, well, guess what?
Some problems aren't, you can't, right.
You need a heart, you need a new leg, you need new lungs. I've been smoking, dung since I was 5 years old. Like, what? They would tell me, they would roll up horse dung with their grandpa, working out in the field. And, I'm like,
You literally
like
smoke horse shit.
voluntarily rolled up horse poop and smoked it? Like, who does that?
No, right, yeah, wow.
You're just kind of like, I wonder why you're laying in this bed with open heart surgery. We call it zipper. I'm like, wonder why.
Well,
you're
and just the
laying there with a
diet,
zipper.
the
Like,
diet change that's down there. Now,
Exactly.
don't get me wrong.
So-
if you live in Chicago and eat sausage, every day, you're gonna have problems
sausage
too.
and our
right?
hot dogs
Right,
and
right.
whatever. But so and the diets are very different. So if a doctor did come out, they would do house calls. And they didn't have insurance. They would pay in, seriously, eggs, chickens. They would pay in home meals. We still had a couple of the docs who would leave the hospital and still make, and they were the old docs, they would leave the hospital and go make their rounds at the houses. And they would still be taking eggs,
Wow.
homemade meals, stuff from the gardens. That's how they got paid.
I think it's cute and everything else, but I mean, if it's precluding you from seeking care until you're almost dying, I mean, there's things, I would equate it to like the brakes on your car. If you let it go to forever, it's going to cost you way more. So that that's another thing, cost gets way out of control. Right? If I go in and just get my brake pads changed, it's going to cost me a couple $100 to get my brakes done all the way around, all 4 done. Where if I let the thing tear up my rotors and everything else, it could cost me $1,200 to get it fixed. So it's the same with healthcare. If you wait till you're at stage 4 cancer, well, this is going to be you're probably going to die.
Well, absolutely.
So, and the same thing goes with a busted shoulder, a jacked up knee, anything that if you got ulcers and you just let it go, it's going to get worse.
But a lot of them would do home treatments, home remedies,
Yeah, that's
or
probably
you know
interesting
what I mean?
too. Oh my God.
Or they've got a big boil or a big ulcer and they just lance it themselves, or my arm was broke and I just fixed it myself. You're just like, oh, okay. But I mean, that was the mentality because, well, I've got a farm. Nobody's going to farm for me. Nobody's going to take care of this. Nobody's going to do that. So that was kind of the mentality, and they were still kind of stuck in that. More and more as we get, to where
Somebody
we are.
is listening to this podcast, like wishing it would just go back to that. Like, they're like, that sounds awesome.
So more and more now, though, we have now all these screenings in place. We have educated patients out there now, and now we are, proactive with educating patients more, and now we have Dr. Google.
Well, that's got WebMD has got to be a pain in your ass.
It is a pain in my ass.
People, then the other thing that we have, and I don't know if this is state to state or what, but the amount of medical ads that are like, I'm always watching a medical ad thinking, why would I ask my doctor to put me on Lipitor? Why do I have a idea that what I need when I go? Should my doctor just have that idea before?
But there are many patients who will walk into me and
I
say,
gotta
I
imagine.
want this done, this done, this done, and this done. And you're just kind of like, okay, well, look, you really don't need that done because that screening is done
Well,
at
now
this
he's going to be
age.
telling you what they were
But
prescribed.
they do. They walk in and they tell me, I want this medication because I have, and you're just like, well, I Googled my symptoms, and when I Googled my symptoms, this and this came up, so I'm pretty sure I have this. And you're like, okay, let's have this conversation. Let's see what you have. Let's do this. Nope, pretty sure this is what I need. So, but then you will have the person who is a pretty educated person, and they have went to valid sites, and they have kind of said, I've been having this. My mom has this. My brother or sister has
Right,
this.
it's hereditary.
Grandpa had this.
Genetic.
So, do you think it's a possibility that maybe, and what do you think we should do? That's a conversation that I enjoy having, because this person says, what do you think? And so that way I can kind of say, okay, let's go through your history, your family history. What have you done? What haven't you done?
Right.
Where, who, I can't even talk. Let me have another glass of wine. Who have you seen?
I'm as many as I can.
What test have you had done? What haven't you had done? And let's go from there. And then let's get a treatment plan together. I'm that person where I'm going to offer you different things, different options, and then we're going to work together. I'm not going to tell you this is what we're doing, this is what I'm ordering. But I also don't appreciate when you come into me and it's like, well, I want Norco. Okay.
Oh, right, well.
And that's a whole different,
crazy, right?
That's a different other ballgame.
Yes, but that's still, that ballgame still ties into the healthcare system being broken, because
it's sad.
right, the fact that people are getting not rich but wealthy from the healthcare industry is an issue.
It's the wrong people getting rich.
Well, that too, but I mean,
It's
there's
not me. It is definitely
no,
not me.
right.
I mean, the overhead for us is just disgusting. For us to buy supplies, to run an office, to be able to offer the proper blood test and screenings, we call point of care. Things that I could do for you is you walk into my office, that I can do what we call an A1C to check what your blood sugars have been running over the last 3 months for you, to say, hey, Bill, do we think that maybe you might potentially have a blood sugar problem,
Right.
And to do that right now, instead of sending you over to the hospital or drawing your blood and then sending it off to the lab, I can do that right now in my office. To order that, to be able to do that in my office, it's not cheap for me to do that. Who's making that money? And I can tell you for sure that for me to order that kit and to order that machine to do that, insurance reimburses me for that kit and that machine. That's several $100s for that machine. And then for the kits, for 10 kits, it's about $100 for 10 kits. Insurance reimburses me $8.05.
Right.
And I'm like, that's not for the Lancet, that's not for the alcohol pads, that's not for the time of doing that, that's not for the 2x2 and the Band-Aid that goes on there. And I'm just like, okay.
Yeah, right. No, yeah, so, yeah, it seems like it's almost an insurmountable situation, that it's broken from top to bottom, that everything about it is broken. The other thing that, people have this misconception that people do a job for, that somehow they'll do a better job for better financial compensation. Right. And I felt that most of the people in the trades, that's not true. You need to make a certain level of money to make sure that you're making money. But then anything over that, I'm going to build your deck a certain way. I can't build it any better if you paid me twice as much. Mm-hmm. Now, I could buy better material, but that's material. Mm-hmm. I could use that same material on any deck as long as the material is paid for by the homeowner. But I'm not going to put double the floor joists. It's not going to do anything to make your deck any better. The material is going to be there, but it's not going to be any better. So people that are good at what they do, take pride in what they do.
Right.
They don't show up. I mean, you don't show up every Monday morning and go, "Oh, I'm here for that paycheck on Friday."
No.
That you're there because you're there to solve problems. And if anyone is there just for the paycheck on Friday, you don't want to see that person anyway.
I don't want you to be there.
No, right.
Because you don't want to be there.
Right. So I mean, and then the problem that we talked about earlier is not the person that's the hands-on practitioner. It's the person that's the VP. It's the person that's making some obscene amount of money.
I want to see their job description.
Right. Well,
Show me your job description.
right. Now people don't. I think people don't realize that exists. And what's funny
The
is
job description?
no, the VP that really doesn't do anything. The title head. What's funny is those are probably people who work a job that they could point out the guy at their work that doesn't do the job but gets paid more than they do. Like
I'm not saying their job isn't needed, but is it needed? I mean,
well, is it needed,
how
and then
many,
are
how
you
many
getting paid
VPs
way
do
too
you
much?
need?
Right.
So,
So-
and your salary.
Right, exactly. So, I wish there was a magic wand that could be waved and there was some other, like, solution to the problem. I wish there was some other way to do it. I see things that are put on the news that say stuff like, if we do socialized medicine, it's going to cost this many trillions of dollars to do socialized medicine. And what they don't tell you is healthcare is going to happen anyway. So, like, we're already spending that money. You need to do something to try and cut the cost of this to begin with. And if you took out the 30% that the middleman makes, and you took out those couple of VP jobs that you could and everything else, and then you also had the single payer be able to say, I'm not going to pay you $18 for this, I'm going to pay you, $3 for this, you will start to cut costs. The problem is that people are going to get cancer, people are going to break legs, people are going to get sick. We're already spending the money
It's a guarantee.
we're already spending the
Healthcare's a
money.
guarantee.
Right. They're talking about money we're already spending. It's just how are we going to spend it? Who is going to be the person spending it, and how are we going to do this together? The problem that we run into is our media and things that we take in are put out there by wealthy people, and generally countries have a progressive tax plan to pay for healthcare for the population. So I told you just talking before the podcast, I know a bunch of Canadians. I know Canadians that make, $25,000 a year, and I know Canadians that make $350,000 a year. They have different perceptions of their healthcare program in that country. The guy that makes $25,000 a year, he thinks it's the greatest thing since sliced bread because if he breaks his ankle, he goes right in. They put a splint on him. They send him right out if a guy breaks his arm. The story that I have is a guy who was a fishing guide, young kid. He was probably 22. I know we pay him for a whole week, so I don't know what he could make, beyond that. But it's within, $400 or $500 a week is all he was making. He shattered his arm terribly in a snowboarding accident, and he had it fixed and everything else. And then we had a talk in the boat, and at that time, I think I was like 26. I didn't know that Canada had socialized medicine. I didn't even know it. So I felt real bad for the guy. I'm like, I was saying to my dad, I'm like, hey, how is this guy going to pay all those bills? Because what he described to me, because I kept in touch with him after I came home, he described multiple surgeries with pins and all these splints and then tons of visits to the doctor. He was off work for a ton of time and everything else. And I was like, how is he going to pay for the hundreds of thousands of dollars that's going to cost for this to go on? I think they helicoptered him and stuff like that. Like the bone was like sticking out of his arm and everything else, right? So when I got there, I'm like, when you're in the boat with somebody for 8 hours or 10 hours, you really talk about everything. And I'm like, all right, man, I got to ask, how are you going to recover? You have to file bankruptcy or something, right? Like something's got to happen. He goes, file bankruptcy. And then he explained he explained to me that none of that. It didn't cost him anything except for his time to go to the doctor. And he goes, it was a hassle and it was painful and everything else. But no, and I go, I try to run through every scenario. So the scenarios that the media and the people that oppose socialized medicine will throw at you are, it's going to cost us too much. Mm-hmm. That's nonsense because we're paying for it already. Like, if he broke his arm in our system, he would pay for it. Like, it's going to get paid for. So, like, people don't get the healthcare that's provided by your socialized medicine. It's not a nose job. It's not elected surgery.
It's not elective, right?
Right. So the healthcare that we're talking about is going to happen no matter what.
You're sick, you need it.
Right. First off, if you're sick, you're going to go to the doctor, not wait till it gets worse and then go to the hospital. So that's going to be cheaper healthcare than the other way. So that the how we're going to pay for a thing drives me nuts, because we have no problem paying for aircraft carriers, tanks, jets, and missiles and bombs and no problem. We don't ever bitch about that. But healthcare, that's the thing we're going to bitch about. So I throw that one off the table right away. And then the second one is the wait time thing. And I'm like, all right, this guy was in pretty bad shape, obviously, bone sticking out of his arm when he went in the first time. He got taken care of right away. Like, it was right away. There was no like, we're in Canada, you have to wait a while with the bone sticking out of your arm. That's not how it works. If you wanted your ACL repaired and you could walk around on it and it wasn't a problem, you might have to wait 3 or 4 weeks to get that done, because it's not an emergency situation. People that have an emergency got to get fixed first.
Right.
But that happens in this country. People wait because they can't afford it. People wait for all kinds of reasons. So that's another thing that's nonsense. And then the other one is like that the care is going to somehow be different. Now, if we were in a socialized medicine situation tomorrow, I wave a magic wand, we have socialized medicine, are you going to do your job any differently?
No.
No, you're going to do your job because you give a shit about the job that
Absolutely.
you're doing. So I just don't get the arguments against it. And this guy, like when he explained it, he was like, all right, so, I went in, they repaired it the first time. Then I made an appointment for like a month or so from then. They pulled these pins out or did the screw, whatever they had to do. I don't remember, it was a long time ago. But he had 3 different surgeries he had to have on his arm done. And he got all those done. He got his medication was paid for. That was not a problem for him either. And I was like, wow. He came out of it with the situation of, it sucked that I broke my arm, but everything was taken care of, so I was good. And then I explained to him, you understand that it would be $150,000 for what you're explaining. I'm just saying, it's got to be $30,000 of surgery for everything you had. That's 90, and then all the other
If he
shit.
was airlifted? Oh.
Right. So who knows?
Yeah.
But and he was like, "You're kidding me," and he goes, "You pay for that," and he goes, "What happens if you can't?" Because he couldn't. He was like renting a little, trailer to live in and stuff like that with his girlfriend. There was no way he was going to come up with that money. And I go, well, people file bankruptcy, so that's something, and that's really awesome for you, because 7 years go by before you can buy a house after you file bankruptcy. So that's a fucking mess. And then the other thing is people go into debt. They go into huge debt, to pay their medical
You
bills.
lose everything.
He couldn't believe that's the system that we lived in, because we're America. We're supposed to be ahead of the game. And so I'm kind of actually stewing about this, because I knew at that time, this is before the ACA, before covering pre-existing conditions, before, people would lose their homes if they got cancer and stuff like that. So I'm like, how could this be? How could you live in America Junior up there and that they're paying for that? So like we're in the boat, and I'm like, I go, wait a minute, what is, I thought, it must be like Sweden, where you're getting taxed 80% or something crazy, right? And he's like, no, he goes, we pay about 3.5% more taxes than you do, right? And I was like, this can't, how could this possibly be? How could this be covered that way? And he said, well, the government says all of the clerical work that's done in the insurance industry gets done for about 3.5% of the medical cost, of the cost of insurance. The other 30% is the profit. That's the guy that makes the $89 million a year. Because, when someone says the CEO of Blue Cross Blue Shield made $89 million last year, that's just one of their CEOs. There's not just one of those guys. There's a whole panel of those guys that are CEOs and OCOs or whatever, whatever they're called, that make a ton of money. That's your middleman. That's the profit. That's the yacht that the guy's on, that sort of thing. The lady that's pushing the paper across the desk, she's not making millions of dollars. She's making a job just like anybody else. So I was like, all right, fine. So then I was good friends with the people that owned the 75 cabin lodge that we were staying in Canada. And I made a point of talking to them. So about 2 nights go by, and I said, hey, what do you think about this healthcare system that you guys have in this country? He goes, well, first, I wouldn't trade it for what you have. But he goes, I hate it. I can't stand it. But you guys are insane that you pay for your own health care the way you do, and then nothing controls the cost either. So he was explaining, he has a friend that's a heart surgeon, and this heart surgeon makes a fine living. He drives a BMW, everything goes real well for him. But if he lived in the States, he'd probably make 5 times the amount of money that he makes here
Sure.
because it's just a better paying gig. Um, so, because the problem that I have with the healthcare system, the national healthcare system in our country, is that it's paid for on a progressive tax system. So I make $350,000 a year. I pay quite a bit more, first in percentage, then extrapolate the fact that the young guy makes $25,000 and I make $350,000. I pay about 25 times the amount that that guy pays into the insurance system than he does. So I feel it's kind of unfair because he breaks his arm and has $100,000 worth of bills to pay. I'm the one actually paying those bills.
Yeah.
Now, I can't cry anybody a river that makes $350,000 a year. It's not in me to do that. You have a fantastic life then. Things are wonderful for you. Everything has worked out fine. You could have been born in Ethiopia, no fucking feet, but you're not. You're this
Right.
guy.
Yeah.
So count your blessings. He goes, no, I get it. And I'm like, this guy, he spends all of the summer months in Canada on a beautiful lake, owning this beautiful lodge, and then he goes to Key West for the other like 3 or 4 months out of the year.
That's
And
rough.
yes, really rough for him. So, we're all in this together, sort of a thing. And the guy that would have broke his arm that way in this country, he could forget about ever going on a vacation for a very long time.
Right.
Or this guy that in Canada, he could go on a vacation. He can do things. This guy makes his living from people that are on vacation.
Yeah.
So he's making the money, $350,000 a year, because people can go on vacation. So we're all tied in together. What we need to do, we're the United States. I believe that we should be able to come up with a better solution than say Canada does. Per capita, we make more money than people in Canada do. We should be able to have better health care than they have for sure.
Right.
So, and I mean, I have people that believe the news, and they believe that everybody that gets a knee surgery in Canada gets in their car and drives down here to get knee surgery. That's not true. It's just not true. Now, I know people that work at the Rehab Institute of Chicago, people from Iran, people from Iraq, people from all kinds of Middle Eastern countries do. But it's only the extremely wealthy people that can afford to just hop on a plane, come get open heart surgery in this country that do it. So the John Oliver has had a line that said, we all have this pre-existing condition that's not called not being Beyonce. So the healthcare industry in this country works wonderful if you're wealthy. If you're not, then it doesn't work that well for people like that. And you have to, being that you were in all these other states, you had to run across people that were so damn poor, they'd pay, like I said, you're paying for it with eggs.
Well, here's a perfect example of that. So I had just literally graduated nursing school, was transitioning into nursing on the floor, and we were getting ready to move from our current location into another, duplex. And I was getting ready. I was splitting my time part-time, working before, while I was working as a nursing student, I was working in the pharmacy at the hospital.
Okay.
So, and then this is the same hospital that I was doing my nursing clinicals in, which was perfect. So that's kind of one of the ways that I got to get a position in cardiac ICU, is because they realized that I was trying to learn, and they realized that the person that I was, and I would be, like, hey guys, I was listening to you guys, and you were saying this and this, and
Microphone a little bit. Just drag it over this.
Yeah, sorry.
That's all right.
and the doctors, I'm doing my, shifting
Yeah,
around,
yeah,
sorry.
yeah.
And the doctors realized that, hey, this girl likes to learn, so they would get a trauma in, or they'd get a cool surgery, and they're like, hey, Stacey,
Yeah.
the director of pharmacy would be like, Stace, they've got something cool going in. The doctor's calling for you. This is when you could do that, 20, well, that's, while I was in school, so 26, 27 years ago, hey, Stace, go down, watch it. And I'm like, are you sure? And he's like, learn.
Yeah, right.
I would walk into the pharmacy, and the pharmacist would throw me a bottle, and I'd catch it. I used to play softball, and I catch it, and they're like, I look at it, and they're like, what is it? And I'm like, furosemide. What's another name for it? Lasix. What doses does it come in? I'd name it off. What other routes can you give it?
Okay.
And I'd start it, okay, what are the side effects? What do you got to do? So I really learned, and they'd be like, all right, I'm going to go mix some IVs under the hood. Come with me. And they'd let me mix. They'd let me do things. They would let me, watch and observe and learn.
Sure.
And so it was really great. And so here I was given this opportunity. So I'm working part-time as a pharmacy tech and then part-time as a nurse on the floor. I didn't have full-time, so I did not have benefits
Oh, good Lord.
because you're half and half, you're not still full-time, even though I really was full-time. So I'm going up and down the stairs. I have a box. My 3-year-old is sitting there. You know, she's like, "Mom, we're gonna be late." You know, I'm trying to hurry up because I have second shift. And she's like, you're gonna be late dropping me off at April's. I'm like, "Okay, Katie, hold on. You know, I'm trying to get this last box in the car so I can just drop it off. You know, I'm trying to get things done." And
Right.
I'm coming down the stairs and I had penny loafers on.
Oh.
Yeah.
Right.
I slid, end up, come down the stairs, and it was that indoor outdoor carpeting. You know, it's like, you know, we're both students.
Yeah.
We're cheap. You know, we're not cheap, but it's, you know, we're poor. You know, and I end up going down and skipped 3 stairs, and I landed on top of that stair, on top of my ankle with my foot bent backwards, and stepped on, you know, on it,
Jeez.
rotated it, and twisted, fell, snapped my ankle, broke it, tore it, busted my head.
Right.
End up going into the ER, and the doctor's like, "Yeah, this is broken." I was like, "Yeah." He's like, "Well, we stopped casting in the ER at that point because it became a liability. When you cast it in the ER, if something happened, it was swollen."
I see where this is going. You're in an awful position because you make too much money to...
I didn't make enough. No, I didn't have too much money.
Oh, okay. But I mean, I thought you made too much money to qualify for stuff like Medicare or something like that.
I mean, Medicaid?
Medicaid is through the state, right?
Well, yeah, but I mean, So we never applied for anything like that.
Right.
But here's what happened. So I end up going in to see the orthopedic surgeon. The first thing out of his mouth was, "What insurance do you have?" This is a physician who I know.
Yeah.
I work with him, you know, at the hospital. I go,
Right.
"I don't have insurance." He goes, "Casting it is." It was a surgical.
Oh,
it was surgical.
wait.
It needed surgery. But because I didn't
So
have
the
insurance.
money decided what they were going to do with your... Right. Oh, that's
So
terrible.
I was 23 years old. I tore and broke it. Like completely tore and broke everything in that ankle and broke it.
So now, did it set
So
you
he
up for
casted it.
future problems then?
Yeah,
Because
I ended up breaking and tearing
this
it
is where
again playing
healthcare
softball.
cost ends up compounding because we didn't do it the right way to begin
Oh,
with.
you should have seen my bills. I was paying, because, you know, here my ex was a student. He was a mechanical engineer going to UMR. And we have a 3-year-old, and we're trying to pay my student loans, his student loans, and I have no insurance. So we're paying my bills. I got a 25% discount because I was an employee there. That was it.
But 25% is huge. That's a lot of money off even.
Yeah, but
And still a horrible situation.
for
I'm
the
sure.
for the orthopedic, you know, for an ER visit and then
Right.
orthopedic bills.
But somebody would kill somebody for 25% off.
Yep.
Especially if you had like,
Yep.
you know, a massive amount of bills. So, okay, right. So none of that makes any sense.
Yeah.
Like none of this is from somebody who, we have a lot of smart people in government. We do. I mean, whether they have motives that are, you know, self-based or not, that can be debated.
Mm-hmm.
But there's still smart people there. If you took yourself back and said, how could this be fixed? It obviously can't be the way it is. This
Mm-hmm.
can't be the way that we do this. This person knew you and was like, well, it should be done this way, but we're going to do it the other way because that's all you can afford.
Yep.
So, okay, so that leads
But
me...
could I have?
What?
He didn't even ask me if I could have.
Right. Oh, right. He just was... He
So
just was
I ended up having to have it reconstructed in 2012.
oh, right. So, right. And you had benefits then at least, so you get it done. Holy cow.
Well, I mean, it ended up causing me so many problems over the years that it was, you know,
Right.
finally to the point where the orthopedic surgeon that I was seeing at that point was like, "You have no choice. It's got to be fixed." He's like, "It's just giving out on you," and I was falling down, you know.
So the connected to work thing is a thing that if you're a conservative and you just don't eat the spoon-fed crap that your conservative news, you know, gives you, and you look at the rest of the world, there are conservatives in other countries that they're all for socialized medicine because it decouples it from your job. So first off, you know, if you're an electrician, or you know you're working at a hospital or whatever it is you're doing, your healthcare is connected to your job. So you get your healthcare paid for through your job. It's a benefit now, right?
Me?
Yeah.
No.
Or, no. Why not?
I don't have benefits offered through my position right now.
Oh, good Lord.
I
Right.
have
So,
benefits through jobs.
so you just, oh, there you go. Okay, right.
Benefits in healthcare are really not that good either.
Right. Okay. Well, if they decouple it from a guy that gets it from, you know, so you got a union job and you get your job there, I have a buddy of mine who's a terrific concrete worker. He got a job when he was like 19 years old at FedEx. And he got that job because the trades are sometimes up and down and you can't count on it. And most of the trades out in our area, there are no benefits. It's non-union. It's just a guy paying you hourly to come break your back.
Yep.
So he got a job at FedEx, and then he would work anytime that he wasn't at FedEx, he would come work concrete. And he was good at what he did. He's a good guy, works hard. He got married young, had kids. He could never leave FedEx to open his own construction company because he could never leave those benefits. He could never quit doing that. So there's an entrepreneur that couldn't be. And I'm telling you, as a guy that was in the trades and seen his work, he does my flat work here now. He would have done a fine job as a contractor. He would have been a fine contractor as far as that goes. He's not able to do that because he's locked into this FedEx job. Now, I look at it honestly like that's wasted talent. The guy would have been good at it. He does good work. He's delivering packages instead because he gets his benefits that way. So I don't like that. Secondly, again, the cost of healthcare is still being paid for. It's being paid for by your employer. If we alleviated your employer paying that wage, you could still be in the union and then fight for better wages. You could actually make more money to cover whatever taxes or whatever are going to come up to make up for it. So if now all of a sudden your boss is not spending a couple $1,000s a month on your health care, it can give you that couple $1,000s in your paycheck because that's part of your benefits. So I know guys that are in the carpenters union that add up what they make in benefits along with what they make by the hour, and they consider that their compensation. I'd rather have that money in my pocket than say, all right, you're going to buy health care for me, sort of a thing. So, there's a conservative angle that looks at it, and also if, like I said, you can remove the middleman and you can, control costs because you're the single payer. Also, if inevitably it's paying less, the news constantly wants to ask people like Bernie Sanders or Elizabeth Warren, are you going to raise taxes on the middle class? Now, Sanders is honest, and he's like, yes, taxes are going to go up, but you have to wait for the second part of the question. The second part is, you're going to get rid of your premiums, your deductibles. There's people out there right now with a $5,000 deductible.
Yeah.
They don't have $5,000 of expendable cash on them to begin with, but they have a $5,000 deductible. They carry the insurance. I don't even know why. If you don't have $5,000, your insurance is worthless.
Right.
Can't pay the deductible. So you're going to have all that be gone, and your taxes are going to go up. So if you had $8,000 a year you were spending, but your taxes are going to go up $5,000, you just netted $3,000 gain. So it seems to me that would be the better thing to do, but the news only asks the first part of the question, are they going to raise my taxes? And then people run off screaming at their television set, he's going to raise my fucking taxes, he's a goddamn socialist.
Right.
So, being in that industry, do you have any better ideas than socialized medicine? Now I promise you, anyone's listening, I did not ask Stacey what her position was on this. Now, I have an educated guess because I know people that work in the healthcare industry. And I know an ER doctor. I know the girl that I dated for years. They all say pretty much the same thing. This has got to change because we're spending a good part of our day that we could be helping people with their healthcare needs on fighting with insurance companies.
Yep. And that's it.
That's terrible. You're a talented person at what you do. You have a heart for what you do. But instead, you're fighting for money. Make any sense?
And the big part of it is that really pisses me off is that the insurance companies dictate how I can treat my patients and what I can and cannot do. I have to jump through the hoops. I have a patient that comes in, clearly has radiculopathy, but nope, I can't order that MRI. I have to make them go through XYZ PDQ, and they have to fail all that before I can order that damn MRI.
Wow.
And I'm like, okay. So you're going to make them go through all that. And that's going to piss
Cost.
that patient,
And
right?
cost more because they're going through all this other stuff.
And that is my thing sometimes. I'll say, but you understand this is going to cost you more and that because you think that this PT and this is really going to help them. It's not. I know that I guarantee this is a disc issue and you just need to, nope, they got to do this. I'm like, okay, this is going to end up costing you more. But okay, we'll play your game and the patient's going to be really pissed and this is going to cost you more, but sure, we'll do that.
The PT industry has become huge too. I mean, every strip mall's got a therapy outfit in the strip mall now.
PT, there are some really good PT things, but then there are some that are just, how do I put this? That are in it to see. I went through some PT that basically I walk in there and I check in and they're like, okay, hey. And there's like 20 people there and I think they lose me and all the other people. And I get on my bike and I'm on that bike and next thing you know I'm standing and I'm waiting for the next exercise to do because that person's and I'm just like, oh my God, I've been at work for 12 hours and I'm so tired and I just really don't want to be here right now. And you really want me to stand here and wait because you've got 20 other people. So it's like 20 patients to 2 therapists and you're charging my insurance how much for me to be here? Right. I clearly checked the wrong box on my application.
Right, and that's another industry that if you have a single payer, because it's amazing if people found out if you went in with money to pay for healthcare, and then versus what the insurance company actually will get billed for. Do you know what the percentage difference is? I know it's considerable. Like if I was to just say to a doctor, hey, I need to have surgery on my knee. Just give me the bills. They give me the bills. It'd say it's $100,000 to reconstruct my hip or something like that. The insurance company's going to pay what, like 70% of that or 60% of that? Or
I
something?
don't. They
it's a reduction though, right?
There are, yeah, and it's the negotiated discounts.
Right, which is already built into the system.
Correct.
So if you're someone that comes in, they're going to run you through the ringer for sure if you've got money, and then that's every insurance company is different. I don't know.
So say that
again. If you're a bigger insurance company, do you negotiate a better price
with
the healthcare provider?
So the insurance companies will have different negotiations with different entities. So they may have it different with ATI versus I probably shouldn't name names. But
no, right. But Aetna and Blue Cross Blue Shield are paying for the same thing. Can they pay a different price?
Mm-hmm.
Right, and then you said you did nursing geography-wise all over the country.
Mm-hmm.
Different things cost different things
Correct.
In different spots too.
And they may pay hospital B a different, they may have a different negotiation with hospital B versus hospital C versus hospital E versus hospital Q versus hospital P. So it depends on their negotiations. It depends on the what their company, like if the how do you say it? The employer, okay, it's what the tier, what the employer has for the tier, what their employees are paying, what the employer has set up.
Right, okay. So the package of insurance that they have dictates too.
Correct. There's all different.
Yeah, there's two. I mean, clerical wise, I know from talking to the woman that I dated, like, she has to know what insurance company she's talking to the VA. She knows she can get this.
VA is a total different ballgame.
Right, but she knows that she can get this for them. She knows Blue Cross Blue Shield will cover this.
Correct.
She knows that Medicaid will cover this.
Correct.
She knows Medicare will cover that. So, like, there's all kinds of things that you have to know to begin with to do that. If you went to a single payer system, you'd only have to know the one system. It would obviously streamline something.
So CMS, Center for Medicare Service, okay, so Medicaid, Medicare Services, CMS has pretty well kind of said, based on this CPT code, based on this, this code that you're giving us, we're
I've heard
going
this before.
to basically get, this reimbursement for this amount. But there's also negotiations that kind of go on. So if I am going to order an MRI or a CT, basically I know that they're probably going to reimburse X amount of money, but there may be other negotiations. I can basically say they're probably going to, give me $150 for this CPT code, but there may be another negotiated on there. So they can say no more than this amount.
Right. Where I hear the code stuff all the time is wheelchair stuff. Mm-hmm. So, there's all kinds of different grades. Oh, I'm sure my cat will.
Yeah, I was like, she's okay.
He. But so, you can get plastic casters on the front of your wheelchair. They're not great. They could break, all that kind of stuff. You can get like aluminum ones. You can get an aluminum frame on your wheelchair, or you can get a titanium frame on your wheelchair. Now, different insurance companies cover different things. They don't allow other things. Some things they make it. it's a letter of medical necessity. So
Right.
if they decide that you don't need this
Correct.
to get around, then you don't need it.
Correct.
And when the people that are in charge of making money are the ones that decide what you need,
Right.
it can get pretty hairy because I push around a 38-pound chair. If someone put me in a 78-pound chair, pushing around becomes a different thing. It's definitely tougher. And I know some meatheads out there that are in wheelchairs will say toughen up, Buttercup, but that's nonsense because
Well, you
I
have
can
a wheelchair. Why can't?
right,
It's a
right.
wheelchair.
I can be
I
more
mean-
productive in society if I have a chair that I can push around all day long
Right.
without having to take a break or whatever like that. So having different insurance, it's great if you're. I don't know if I'm all for like getting rid of private insurance all in general because I know Canada has like a mixture where you can still have supplemental private insurance. So if you want to get the private room or he's joining us, then you can because you've got the platinum plan insurance added to your
Right.
national health insurance there. So it's I had Rob on the podcast and we had a bottle of bourbon.
I remember.
Yes, knocked the
Yep.
bottle of bourbon out. So the
Yep.
cat was
That's
like,
why I was like, oh.
I'm getting on this podcast, man. If I can coax him into the bedroom, I usually put him up, but because he is a ballsy cat. He doesn't care who you are or what. He's gonna get up there and get some petting. So I want people that if you're somebody who's got the dough, then you can buy that supplemental plan or whatever like that. But what I want is that the minimum coverage for someone who is not. And I want people, like when you see someone come in and they've let something go, then your heart kind of drop like, why? Why would you let this go?
Right.
Why would that ulcerated sore
Yeah.
be this bad at this point? Like, we'll remove your leg now
Right.
because this is that bad. And then like diabetics, same thing. Some of those people let things go to you have to amputate a
Right.
foot or something like that. It's purely based. Well, I'm sure some of it's based on you're a knucklehead and you didn't come to the doctor,
Sometimes.
but sometimes it's based on what can I afford. Is this going to ruin my life if I go to the doctor now?
And sometimes that's a lot of it, and it's pride because they're like, I can't afford it, and
Oh yeah, that's
I
embarrassing.
don't
Yeah.
want to be embarrassed. It's either I need to pay my bills, I have to have electric, or I have to have food, versus I have to have my insulin or I have to have my
Right.
medication.
Right.
And so I have to live versus, I guess, if it's cut short for a few months because I can't afford my insulin, then I guess that's what it is.
Right. Right.
And I've had that. I have had that. And I did, I did work with indigent patients and, cardiology, and we got them medications. And, I try to tell people that we do have those programs out there, the pharmaceutical programs. They're not advertised, but they are available. But some people don't want to jump through those hoops, and that's fine. There are some people who sometimes take advantage of things that maybe necessarily don't always need it as much as somebody else. And, that's okay. But, the people who really need it, I just wish that we could help them out a little bit more.
Right. Now, have you seen some of these free? They like set up a tent and they bring in like there's a couple of outfits in that are in the United States that bring in. Come on, man. I mean, you got to be that obtrusive too. Like it's got to be like, come here, come here, come here, goofball cat. But so they set up a tent, and then people are lined up outside. It's a lot of times like it's in Arkansas. It's it's in spots that there aren't like rural areas where they don't have that much healthcare available to them to begin with.
And the free clinics.
The free clinics, right? And I mean, there's people lined. This is America, and they're lined up
Yeah.
like down the block
Yeah.
to get in to have teeth removed and have and it's all because they can't afford it because this is free. So like these.
Which then you have to think, like I said, supplies are not cheap. Medication, and we have a lot of medications that, I'll go to order something and they're like, oh, lidocaine's on back order. I'm like, how the hell is lidocaine on back order? Like, how can you not be making lidocaine?
Right.
And,
Well, the other thing is that lidocaine probably costs one thing here in the U.S. and then in Canada it costs something totally different. So,
Right.
there's the EpiPen thing is always the thing now, where someone could spend $1,000 on something here, and it's $100 thing in Canada. Now that to me, it's immoral. Like that should not be the way this should be.
Yeah.
And then secondly, like if we're the United States, I don't understand how we're not. We have to be. Our government has to be so bought and paid for that they're just letting this happen to people.
So bottom line, our money is spent on things that it should not be spent on. Our thought process is...
You really just push him down if you
He's
need
not
to.
bothering
Okay.
me. Our thought process, our money is not being spent and dispersed where it needs to be.
Right. But when something is 10 times the cost, you can say that with a single payer, we could actually cut costs in a way that the trillions of dollars that they're talking about would not be trillions of dollars, because
Yeah.
you're going to cut all this fat out of this situation.
Yeah.
There's no reason that the exact same EpiPen should cost 10 times as much here
Right.
as it does there. And I'm sure there's a bunch of guys out there on boner pills, and if you go online, that shit's cheaper
Right.
than it is in this country.
Right.
So, like, it just doesn't make any sense to me. And then you've got life-saving stuff like transplant, rejection pills that people are on for the rest of their lives.
Insulin.
It's insane to me that there could be a drug out there. This is a thing that we make in a lab or in a factory, however they make this pill, and it costs someone thousands of dollars a month to have. Like,
Right.
that's not right.
Well, you said it earlier. You said when you said the aspirins, it's $3 versus $18.
Right?
The markup is disgusting. A Band-Aid. If you ever go to the hospital, aspirin itemized breakdown.
Sure.
And when you see the list and you see the prices,
Yeah, and I don't know who they're. If you're a conservative-minded person, or you're someone that's been told you're dead set against socialized medicine, when you see that itemized thing, I don't know who you're mad at. Like it's the for-profit healthcare industry. Now, some of these people, they're never going to be able to afford a trip to Denmark. They're never going to be able to afford to go to Sweden and see what healthcare is in those countries. Their perception of it is that I guess it's awful or something like that. I don't know. I'm certain that it's not. I'm certain there aren't hundreds of millions of people, billions of people living in countries that can't get, a broken ankle taken care of properly.
right?
I mean, if you were somewhere like Germany, that would have been surgically repaired for you in the first place, not another time. Now, you literally had to go through pain of recovery and everything twice because it couldn't be fixed the right way the first time, let alone the money. So yeah, I mean, I'm at a loss. I want to have someone that, the podcast is called My Conversations with People Who Know Stuff. So I have, some people that just have factless, uneducated opinions on things that message me like, hey, I'd like to come on a podcast and talk about this thing I don't know anything about. And I'm like, that's a different podcast. That's the, people that don't know jack shit about anything and just want to talk.
I just want to give you my opinion.
Right, give
and
my
that's
opinion.
Fine and great.
Yeah, I do that on social
And
media.
sometimes they can have some good ideas, and you're just like, okay.
Let's give that a shot, man.
Yeah.
If you think, eating rooster
go.
tails is gonna get it done, then get it done. Yeah, I don't know. He's not even like he's a really like healthy cat, but he is not. He's old. He's like 13 or 14
Is he
years
really?
old, but he just is. He does his thing. And it depends on the time of day. If it was 2 in the afternoon, he's sleeping somewhere in the sun. But I'm fine with it. Like I like to have people on if someone like that wants to come on and talk about movies or music or whatever like that, and then they want to interject something about politics, that's all fine by me. But if you have any system can be picked on, right? So if you look at the Canadian system, you can have a gripe about that. You can be like, hey, I had to wait 3 months for my knee surgery or something like that, and you can be upset about that. I got that. But at least there's a system in place. So the people that are like, one guy says, hey, I'm going to provide health care for you, and it's going to be socialized medicine, it's going to be this and that, and people are like upset about it. Combat that conversation with another conversation about what you're going to do.
Yeah.
Like, tell me, right now, Donald Trump says it's going to be the Republican plan, who they've never unveiled, never heard it. It's going to be fantastic. They're going to cover everyone. It's going to cost a whole lot less, and it's going to be fantastic. He doesn't ever give any specifics at all to what's going to happen.
Haven't heard it.
Right. So I just don't understand, and it almost seems like people are immune if they're in the Trump camp. They're immune to the high healthcare costs somehow. I don't know how, if they've ignored it, if they filed back. I don't know what they've done, but I don't have another
I
answer.
guess they're not sick.
Right now,
They
you're.
don't go.
Is this a topic that is talked about around the water cooler at work? Do people say stuff like, "We can't keep doing it like this. This is not." There's got to be some heartbreaking stories about people losing everything over this situation too.
We do. We get a lot of that. We get patients who call us constantly about their bills. I can't pay that copay. I can't pay this. And there are rules and regulations about if we see somebody with insurance about taking copays and not accepting copays
There's
and
another
stuff
crazy
like
one,
that.
right? Like wheelchairs the same way.
There are rules and regulations about that.
To a wheelchair, I can buy things aftermarket and add them to my chair. But if say your insurance company will pay for 80% of something, you can't like get an upgrade, have them pay for the 80% of that, and then you pay the like 20. It doesn't work that way. They'll pay for the one thing that they'll pay for the plastic caster, but they won't pay for the other one. So like if I have a chair, manual chair, and they have something called Spinergy wheels.
Yes.
And the Spinergy wheels, they are like more rigid or something. They use more of the force that I have in my arms to propel myself than a regular wheelchair wheel does. Most insurance companies don't cover the Spinergy
Right.
wheel. Now, that doesn't mean that they'll give you the amount of money for the other wheel, and then you could pay
The difference.
the difference. They will buy you the other wheels. You can buy the Spinergy wheels. Now, that sucks. The Spinergy wheels cost twice as much as the other ones do. So you're pretty much giving me the option of, we'll give you these shitty wheels, or we'll give you nothing towards the better ones that you want to buy. And then, like, I know that if you're somebody that's on Medicaid, you can't have any money. Like, if you have money, then they'd be like, well, pay for yourself. Like, you have money. Like, it just doesn't make any sense to me, the whole way it's set up. So, and I don't know how it works with anything else that goes on, because you can't, I guess, interchange. They did with your ankle, but if you need open heart surgery, then you need open heart surgery. They can't be like, well, is there a cheaper option?
So the way we do stuff like that is, then we call in a social worker. If there's something that happens, it's emergent, that's a different situation. If we have cases like that, we call a social worker in, and then they will help you to apply for Medicaid.
Okay.
Right? And then you'll go through those processes, and then you're either denied or accepted. And then Medicaid Medicaid will either pay for that. If they don't, then you have to square up with the hospital. So then the hospital will either decide, they're either going to write off the balance, or they're going to negotiate with you, and they can either, bring it down and you can pay off whatever, or you make payments. So
If you don't, it goes to collections.
If you don't, then it goes to collections.
Yeah, right. Which is, I mean, that's how it's right.
And that's what you do. You talk to the, you try, if you're in the hospital, then you try to go to the social worker if you have no insurance. If you have insurance, obviously that's got to go through the insurance. But if you have no insurance, then you go to the social worker. The social worker applies for, Medicaid. It gets denied or approved. If it's approved, then there you go. That's what it is. Then if it's denied, then you then go back to and say, I can't afford this. Then that goes back to the appeals. Then, the hospital either says, okay, well, write it off, and then take the loss, because they do write off a certain amount each year, obviously. And then, then they'll decide, okay, we're not going to write this off, or we'll write off a certain amount, reduce your balance.
Now, who decides things that's like, who decides the other things? Like, okay, a person has a partial tear on an ACL, they can still walk. That's not emergency. So, right, like, I mean, like, if someone comes in, obviously, with a gunshot wound, you have to do everything you have to do right now.
Correct.
In the ER.
That's emergent. That's done and taken
so
care
that's like
of.
the Hippocratic Oath or whatever it is,
Correct.
right? They're going to, like,
we take care of the balance. That's something we don't even worry about at that point. Money
Right.
is not an issue.
But we don't care if someone walks around in pain for 20 years. Because that's
Well,
not
I mean,
a
we
thing.
do.
No, you personally do. But, I mean, the people, the purse strings don't.
the purse strings.
The
As
people
in,
that like gonna pay the insurance
well,
company doesn't
basically,
cover
then
that.
that goes back on the patient. So we say, okay, well, you've got this, so we're going to dismiss you. You need to follow up with an orthopedic surgeon.
Right, right. Because I mean, like I said, they don't care if I have to push harder all day long every day. They don't care about that.
Nope, you've got a chair.
Right. I mean, and
You've got accessibility according to them.
right, and I know people who work in the wheelchair industry, and they've come a long way with a wheelchair in the last 50, 60
Sure.
years, right? But there's not really a market for it. Like their research and development departments, they're not coming up with the best, greatest things in the world. Some of the things that I buy for my wheelchair, I buy them from a bike shop.
Yeah.
Because they're coming up with better ideas from
Because
bike shops.
who's making the wheelchairs?
Well, yeah. Well,
Is it somebody who's in a chair?
sometimes there's people that are in chairs that are involved in it, but if there's no market to make, if there's no market to make money on it, those are private companies working for private insurance companies. If you have a wheelchair company and an insurance company, they won't cover it. If you know that they won't cover that, then they're not going to make it.
Right.
It's not going to be a thing, because they can't make any money with it.
Right.
So, but again, single payer would change that. I wish that someone would tell me another idea, because I don't have one.
I mean, it has to start with, first off, the person down here is doing the work. The person, I think, up here is not doing as much as the work, but here's where the money is. So I think the flow needs to start,
Right, and then also the guy up there is not putting eyes on the patient either.
Right.
He might not care as much.
Yeah.
Cat is going to be. He doesn't even bother with me on a podcast. I have a lap all the time because I'm busting around a wheelchair.
Yeah.
He loves for a ride wherever he can go. But
You got the cord wrapped around your bone here.
Yeah,
dude.
right.
And your tail.
Goofy cat. Like I said, I lock him up when I can. And his problem is he's up and down constantly.
It's just sad because it just limits us on what we can do. And for some of us who really do give a shit, we're limited on what we can do, and it really frustrates us.
I'm so surprised that you have a job where you work in the healthcare industry and there's not healthcare insurance just straight up provided with that job.
Where I'm at right now, it's not offered because of where I'm, the position I'm in, because I'm part-time. I'm going to be going into a different position. There will be benefits, but again, usually in our positions, the healthcare is not always that great. Or the benefits aren't always that great.
Right.
And that's sometimes one of my negotiating things too, is because Jeff has benefits, I will always kind of look at, well, what are my benefit options versus what are his, to see if it's a better thing. And then it's kind of one of my negotiating things of, well, I have the benefits for healthcare through my husband, so therefore I don't need it. So here, I'll kind of come back with, here, let's use this. Can I have an extra week of PTO, or can I have, this for, a different pay thing?
Right. Where I would like to see it just all be gone, and then you have a stronger negotiating position because you're not paying for any of that. Like, that's not part of your job.
And also, another thing is, we don't have a lot of union in healthcare. So unions in healthcare is kind of a newer thing. When I first started out, it really wasn't.
That's a podcast I'm looking to have.
Yeah.
I want somebody, and I've got a couple guys that said they come on to, like, I'm a guy that was a non-union shop just because of the geography of where I worked at. We're working out of the city. Union's not a thing, and I got to compete with other non-union, contractors. So, that's fine. And then my job as a realtor, it's non-union also.
Yeah.
There's no union for that. So I've always been a guy that was non-union. Now, and when I first grew up, coming up, I looked at unions like, you guys are fat and lazy, and like, you just got this union protecting you. You can just be this like piece of shit that doesn't do a good job. You're taking coffee breaks. Then I started to realize that when I went on sales appointments, that the reason that I could get a living wage for what I was doing was because in another spot just near me, the union was making sure that those guys were getting a living wage. Mm-hmm. So I understood that was a benefit to me, even though I wasn't in the union. I had to compete in the area that I was in. The union wasn't strong there. and geography in the country, if you live in Indiana, there's no fucking unions. That shit doesn't exist. If you're in Arkansas, like that's not a thing. So I think the union should be everywhere because I think anybody who works 40 hours a week should make a living enough that they're not killing themselves and they don't have any health insurance and everything else. But so I know the importance of a union, but I don't think that a lot of people do. I think a lot of people think that unions are just guys who want to get,
bitch and whine and cry all the
bitch,
time.
whine, and cry, and they get vested in the union, and then they can't get fired and everything else. And it's just not true.
No.
It's what protects people. It's what gave us the 40-hour work week and everything else. But
I grew up a union brat. UAW, look at 719.
yeah, right.
That was my dad. Yeah.
I know a lot of union people that vote against their own interest as far as, when it comes to election, they vote for a Republican who is looking to bust a union. And it's on the machismo propaganda, all this other stuff. I don't know. You see people in the healthcare industry that are in their worst situations in their lives.
I see the worst and the best.
Right. And some of those people, it's not an option to pick yourself up by your bootstraps when you've got heart disease or you've got diabetes or you've got cancer. Your bootstraps are not available to you. It's not a situation you can recover from.
And some come in with no bootstrap whatsoever to pull themselves up with.
So. Right. Yeah. So that's just some nonsense. But I don't know, anything else that you think that somebody out there should know about the healthcare industry? Or do you see any trends that are just completely headed in the wrong direction? Like, what's gotten worse in your job since you've been at it for quite a while? What's gotten better, if anything's gotten better?
Well, like I said, I think that people are getting more educated. I think we are getting better with educating people and doing more of preventative and wellness. So I think people are starting to see that they need to come in and see us. So we're moving away from that trend of not coming in. So people are starting to come in for healthcare. But with that, we've got the insurance who are like, oh, well, we're going to increase up the premiums. We're going to increase up the co-pays. We're going to increase up the medication costs. We're going to increase up that. And you're just like, it's got to stop. It has to. Oh, well, this is a tier 4. So before you can do that, you've got to fail this, and this drug. Okay. Well, that's great. So.
Yeah, right. The drug thing in general, like I won't take anything. They sent me home with all kinds of stuff, just paralyzed guy, you're going to take this for this, like nerve pain and that, and I won't take anything to begin with because everything's got some goofy side effect and everything else. I don't know if it's state to state or if it's federal, the way that they let them advertise on TV now, but it's my running joke that you'll watch the
multiple all day, all night.
Oh, but I mean the commercials with all the side effects. Oh my God, that you're gonna.
Oh, and the attorneys.
I'm gonna have bleeding eye syndrome, and I'm gonna have irritable bowel. So I'm gonna have uncontrollable diarrhea. My eyes are gonna bleed. I could go blind.
Every medication you take is going to have a side effect of this, and this. Come on.
People don't live healthy to begin with. Like, I mean, I eat well and I exercise.
And that's where it starts. We all need to start.
Some people genetically
well.
are just dispositioned that they're going to have health problems to begin with. I mean, if you have heart disease in your family, you better watch yourself because you're going to have that thing.
Put the cigarettes down. Get out and start walking.
Right.
Get out and start exercising.
Have you seen stuff with the vaping?
Oh, I have not seen stuff yet with the vaping, but it's not good. I mean, come on.
Right.
It's not good.
I don't know what the real story is there because I've had people that are like...
We don't know much about it. That's
right.
the problem. We don't know how to treat it.
See people that say they quit smoking cigarettes.
So I'm picking up vaping. I'm like...
They're picking up vaping. Right, I know. What's your progression here? How are you getting to be off of this?
Let me understand this concept.
Right.
All right.
But then I hear crazy things about like bubble lung and all this other like crazy stuff that's going on. And I talked to someone who quit smoking and picked up vaping, and she was like, hey, this is propaganda that's being put out by the tobacco industry or the vaping industry because they're fighting each other, because they're trying to get your business.
They're sucking you back in.
Right. They want to have you go back to smoking because they're saying vaping's dangerous. But then I talk to people in the healthcare industry, and they're like, oh, no, we see problems with people. And then I'm around the wrestling situation all the time. And you can tell the kids that vape and the kids that don't, they have a hard time with their stamina come the end of the matches. I don't know what the answers are. I want to have conversations with people, and if somebody out there has a different point of view that is fact-based, okay? I don't want to sit there and talk to you about this person that you heard about that that died because they lived in Canada. Um, you know, I don't want to hear about that shit. But I want to hear about a solution for. I don't want people to go broke because they got sick or had a car accident or anything like that. And then I'd like to see people get taken care of. I'd like to see a minimum, a line where you guys in the health industry, whoever thought of the Hippocratic Oath, where it's like, if someone comes in with a gunshot wound, you have to fix it.
Yeah.
That's a great
Unbiased.
thing, right? You have to do that. Is that like that in every country? I mean, most countries you
I
can't
don't
even
think
do
it's in
that.
every country, no.
Right, but I don't think you can even do that because most other industrialized countries have socialized medicine. The first question isn't where's your insurance? It's what are we going to do to help you, sort of a thing.
Some of the patients that come into us, they can't talk, So
Yeah, right. They're knocked out.
But I will tell you, when my mom was unconscious, not able to speak, or didn't know if she was gonna make it or not, I was in there. The doctor was in with her. We had just gotten her in from the ambulance bay, and the first question, I get pulled out, and registration comes to me and says, "Do you have your mom's insurance information?" I looked at her and I go, "Are you kidding me right now?"
Oh,
I
yeah,
said, "This."
right,
I
right,
said,
right.
"Do you feel that this is really important and necessary right now?" And she said, "Well," I go, "and the doctor's asking me questions about my mom's medical history, and you're worried about her, insurance card."
Yeah, yeah. I mean, you're in that industry. That is. I mean,
I
that's
said,
the
"Do you
first
want?" I
questions I've
said,
been asked.
"You want her damn it?" I said, "Do you want her damn credit card too?" And she says, "Well, do you have a credit card?" And I go, "Piss off," and just, my husband's just standing there like. And she's, we can't call them cows anymore, but we used to call them cows, or, the little stations that you roll around. And she goes, "Well, I'm here for registration, and that's part of the registration." And I just looked at her and I said, "I know. I work in healthcare. I
Right.
know what you're trying to do." I go, "And this is not really important right now." I said, "If you could tell." And the doctor just looks at her and goes, "Could you come back later?" And I'm like, "Oh my God, right now."
Right. No.
She wasn't even in the door from the ambulance bay and into the emergency trauma area 5 minutes. And they were,
I think the amount of money that it's going to, like, if you're at a hospital stay for a week and you had an ambulance ride and everything else, the money is mounting fantastically, super fast. So I understand when I mean, I don't understand it because someone's health is at risk, but I almost get it. Like, we know there's going to be $100,000 that's going to be owed on this thing. We better start finding out how we're going to pay for it.
yeah.
And then I really don't like the fact that they're going to take a different avenue of care
Yeah.
if they know you can pay for it and,
Yeah.
and then you can't.
Right.
That to me is like, wow, is that the world we're living in, right? So
I
like,
mean,
if I'm poor, I'm going to get a totally different. So that's another thing, right? Like, if I'd like to have someone that was like in the healthcare industry that was wealthy, because their experience with the healthcare industry is a completely different experience than someone who's at a state hospital.
That's tagged a VIP when they come in.
That's crazy. That's just really, like, come on.
Sometimes in some hospital systems, they're tagged as a VIP.
Yeah, I know that in the rehab
I was
hospital.
never tagged as a VIP.
No,
I'll just
I'm
let you
sure I
know.
wasn't either. Fucking very important pain in the
I
ass.
was just a nurse or a nurse practitioner when I was in the hospital, so
Right.
I'm not a VIP.
Well, I know that there's people that come from Saudi Arabia and stuff, and they're sheiks, they're super wealthy. There's been times that Muhammad Ali was at the Rehab Institute in
Yes.
Chicago a bunch of times with his Parkinson's and stuff. And
I've taken care of some famous people and some famous people's family members.
right,
I have taken care of some very cool people and they're like, "Don't treat me or my family member any differently." And then you would have the other ones that were like, "Do you know who I am?" And I'm like, "Yeah."
right.
And
Well,
I treat them
sure
no
you get
differently.
that
I treat you
nonsense.
no differently than I treat the other patients. And if you're going to ask me to treat you differently, I might take a little bit slower to come back on that call. No, no. But
Yes.
don't ask me to treat you any special.
Well, I know that the
Yeah.
people at RIC, the administrative people, they instruct those people to make sure that you're taking care of
We
the
are too.
sheik.
We are
Oh,
too.
yeah, right.
We're
I mean,
instructed.
You're
Do you
told
know
to
who
treat
that
them
is? And I'm
differently.
like, "Yeah." I was like, "Do you know who that is? That's Mary over there." And Mary's been here for,
Right, right. That is.
Do you know Mary? No, but Mary's been here. Have you come down and never talked to Mary? You haven't. But how many times have you been down over here to talk to
Right.
this guy?
I mean, I'm regular Joe my entire life,
Yeah.
and I don't ever think that I'm going to be that special somebody. I think that there's people out there that look at the special treatment that, you know, a George Clooney would get or Jennifer Aniston would get in the hospital, and they think that's right because someday I'm going to be that special person and I want that special treatment as far as that goes. And I know you're not going to be, but you know, I, a life is a life is a life, and you know, George Clooney's going to get great treatment no matter where he goes because he is that. But he's going to get great treatment the minute that guy goes home. He can afford all the home health care that he can afford too. So yeah, you know, I just don't get it. I don't know why people in administrative positions fall over themselves for that. Is there a profit motive there? I mean, can a hospital make more money if, you know, a Caitlyn Jenner comes in and gets great treatment versus,
I don't know, donations maybe?
oh yeah, right. Yeah, that seems strange. That, I mean, I guess if you pay more, you know, you certainly could get a private room and stuff like that, and then, you know, you could get your own doctor to be at the hospital or something like that if you were super wealthy. Uh,
And then the publicity.
the publicity, right? Well, and I would guess the publicity if someone died, you wouldn't want that at your
Well,
hospital.
it would be the publicity, not that the hospital would, you know, advertise because that's HIPAA, but the publicity that if, you know, so-and-so would say that, oh, I got awesome treatment at hospital XYZ and they, you know, they came down and they gave me this and this and this, that they would go out and say that.
Sure,
You know, but, you know, like, you know, sometimes when I would be in the hospital or whatever and the family would be like, oh, you know, she's a nurse. I'm like, don't tell them that. I'm a patient. That's what
Right.
I am. I'm a patient. Don't tell them that. Like,
It's got to be a tough one
because
too.
they're going to kill me though. now
Right, right.
now that they know I'm a nurse.
There's got to be a little bit of a like, you know, for lack of a better word, sisterhood or brotherhood. I know male nurses, you know, so I don't know if it'd be a sisterhood anymore because people's perception of nurses that they'd be female. But there's a male. Like, what would you say the percentage is of males that are in the nursing business now?
It's more now than when I first became a nurse.
Right, right.
But you know, there were 5. So in one of my classes, we were in a small group when I first started out, and there was 5 of us out of 30, and that was a lot then in this one class of mine. And then now you see more. A lot of times, a lot of the male nurses would get into it, and then they would do it to get into more of the management and administrative roles, because that was, you know, when you would talk to them, they're like, you know, what is your goal? What do you want to do? Well, I want to get into ICU, and then I want to get into going into, you know, like a management or an administrative position.
Yeah, okay.
So, you know, but it wasn't.
Your ambitions are different than a female in the job for general.
Yeah, but it was a lot different. Now you see more male nurses than you did back when I was first starting out.
How has the like Me Too movement thing changed? You're like, I mean, you know, I've seen the Mad Men TV show. You've been in the industry long enough. Was it a situation you ever to deal with, like, you know, unwanted advances and stuff from? I would think
Absolutely.
the doctors. I've done work construction wise for 4 or 5 doctors, and some of them absolutely have a God syndrome where they believe that they are somehow more important than anybody else. So you have to work with that on a daily basis. I mean, I'm sure you work with some doctors that are complete pains in the ass dicks as far as that goes. But were any of them, they're in a position of power of some sort in the hospital? Any of them ever try to exude that power?
All doctors have power over nurses because they're in. It's a hierarchy.
Yeah, right.
You're a nurse. They're a doctor. So ultimately, they are in charge. They oversee you.
Right.
So
any
technically,
sexist pigs that were like, you know, that's not appropriate for you to say that.
There were a lot of them, but you work with some very, very awesome physicians, male and female.
Just to make jokes about the job too, though, I know from dating a PT for a long time that, you know, one of her lines was, "That's not appropriate." She would say, "That's not appropriate" on a daily basis, because first off, patients can be completely inappropriate. I know women that work in the home industry where they're like, not home, but like a retirement home or like elderly home, and old dudes can be completely inappropriate as far as that goes. And you're also working in the healthcare industry, so there's a chance that guys are naked in that industry, and that could be a problem as well. has any of that been curtailed or changed in the last like 4 or 5 years now that people are reporting that shit?
I think more people are reporting it now.
Right.
Back
I've
in
never understood it at all. I don't get that situation. I have women friends that are women that get the unsolicited dick pics and like whole like what is with this? Why would a guy think that that's the appropriate thing to do? And then in a hospital situation where I know that there was for me, I was in the rehab hospital for 4 months. I want to say that mm, a good population, maybe 80% of the people that were in the hospital saw me naked at some point.
hmm
Like that was just after a couple of weeks, you just got used to it. It's like, yeah, here I am, I'm naked. And that what seemed strange was they almost knew when I got used to it, and they would be like, hey, I know you're doing your first shower situation. I have a bunch of students. There'd be 8 students that were going to come into PT watching me do my shower, my transfer onto the shower bench, all this other stuff. I really wasn't bashful. I didn't care, but I was like, at some point, like, this is strange that I'm in a room with like a dozen people and I'm the only one naked.
Yeah.
Like, not that I want anyone else to get naked, but like, here I am in this situation. I got over it. It wasn't sexual, but I don't think some people do. I think some people like take advantage of that situation, all that other stuff.
Yeah.
So the hospital has to be a weird deal in that. And then there's the whole, some people think nurses are sexy, and then that's going to be a whole thing too. So I would hope that that's curtailed. And then the power play, like you said, there's hierarchies. So I don't know. I mean, some of the doctors I dealt with, I would not put it past them to be like, hey, you're going to do this, and then we're not going to talk about it or something like that. So
Yeah, I mean, it's more now that I think it's less now is what I should say. More, not more, but
right.
Coming up back in the day, I think you were basically, it was kind of one of those, you just keep going.
Ignore it.
You ignore it. If you can't handle it, you're in the wrong job. You picked the wrong job.
Right.
Maybe this is the wrong job for you. You shouldn't be here. You got other patients. Sorry, just shut up. Keep going. Maybe you need to find a new job.
I honestly saw that. It sounds
you're
harsh.
just kind of like,
It sounds harsh that you maybe need to find a new job.
Yeah.
But I think people going into the industry need to realize that you're not just going to be in close proximity to people. You're going to have to be touching them. There's procedures where you are
against them sometimes.
Yes.
Like skin to skin.
The PT thing, they are moving me. They have hands on. They are stretching me out. I find it probably no different than if you were a masseuse and a guy was
And
inappropriate.
you have to think that I do procedures on patients, and so sometimes my face is in some pretty sensitive areas.
Yes, right. No, I don't doubt it. So I just don't know how bad that some of that's got to be bad.
I have been punched, kicked, spit on, shit on, pissed on. I've had shit slung at me. I have been blood thrown at me. I've had bloody gauze thrown at me across the room. Not at me, but thrown across the room that I was standing, and, a doctor got pissed off one day in the cath lab, and,
Jeez. But I have my own story. I was
It wasn't at me. He was just pissed, and me and one of the other, and it hit the wall, and I was like, what was that?
I was in the Rehab Institute of Chicago, and when I got there, I was right before I got there, I was in a coma for 21 days. So I was 195 pounds before I broke my neck. When I woke up from the coma, I had atrophied so bad I could not pick my hands up off the bed. Like they had to like sponge bathe me, pick me up, like all the other stuff. My first rehab activity was they put my arm in a sling that was tied to the ceiling, and I just did this. It was completely stupid. But in that situation, I had a halo on. I had a cooler that I had somebody in my family rig up with a water tube that went to my mouth because I was getting thirsty from all the painkillers they had me on and stuff like that. So I was drinking water. I had a catheter in, so it was going to a bag that was tied to the bed. And the PCT, the patient care tech, at night, these people don't make enough money at all for the job that they do. I had some wonderful ones, and I had some terrible ones. I had one that threatened me a bunch of times till finally like in the daytime, I was like, hey, I gotta say something to somebody because this person is threatening me. She keeps taking away my water because I was peeing too much. Yeah, she was mad, and I think that my heart goes out to her even because she was awful and she was threatening me. She's like, "I'll kill you if you get more water," and she was mad because I was like constantly ringing the bell because I could see that the bag was like totally full. You got to get this because it's gonna be pee all over the floor and everything else. But
Should have just let it go all over the floor
I
then.
I know, but
Oh
so
my gosh.
what she was doing was she only makes $9 an hour. That's fucking terrible. And I believe
Is
she
that your
was,
problem?
but I believe she was taking a nap. She had a wig that she was wearing that looked like Cleopatra, and the one time she came in, it was like a little kick to the side, and but she was mad, and I was like, listen, I can't move. I can't do anything. I'm paralyzed. I'm in this bed. I'm dying of thirst. She was taking my water away, all this other stuff. But I did not realize what these people made for a living. Like, I thought they made an okay living and everything else. The guy that was there, no, I don't, right. And they have some of the worst jobs because, like, the people that are there, like, if I shit myself, that's who's cleaning me up.
Yeah.
Like this is their job. So you're literally wiping a butt for a living. This is your job, and you're making $9 an hour. So if you do the math, and I know that's difficult for some.
There's no reason the nurse can't help. Sorry.
No, for sure. But at $9 an hour, 50 hours a week, even that's more than a person should have to work to make a living. You're making $450 a week before taxes. Extrapolate that to a 50-hour, you're making $25,000 a year or less than that, in the year, and you're working 50 hours a week. You literally qualify for Medicare and Medicaid because you're under the poverty level in the country, and you're doing a 50-hour a week job. To me, that's unacceptable. We're in an industry where there's somebody sitting at a VP desk making $150,000 a year for doing absolutely nothing, and this person's literally elbow deep in shit, and they can't make a fucking living. So like the one guy, like I'd have conversations with him. He lived in the projects. This was the only job available to him. He could either do this or work at Burger King.
Yeah.
And I'm like,
So kudos to him that he's actually working.
I looked at him and I said, why aren't you working at Burger King? You could make more money probably at Burger King if you were the manager there, and you're never going to be elbow deep in shit.
Yeah.
Like this does not. So like I was buying the guy like a case of Heineken every once in a while because I was like I feel bad. And this guy was terrific. He was awesome. I'll remember his name. His name is Wayne, and he was awesome, terrific guy. But so from top to bottom in the healthcare industry, people that are doing the job aren't making enough money to make ends meet. People that aren't doing the job are making too much money. People that are the middleman for the insurance company that don't do jack fucking squat are making a fabulous living. This whole thing is jacked up from top to bottom, and we wonder why people don't get proper health care.
And why it's burned out, why we get mad, why we get frustrated, why there's turnaround.
Sure. I mean, some of the people, like you were saying right now, you're part-time, but there's people in the healthcare industry that pull 16-hour shifts and some crazy-ass shit, right?
I was doing that.
Right. Yeah, so.
I mean, just a little bit ago, I was working like 70 hours or more.
Yeah, no, that's not. I'm a believer that, and I'm a crazy worker. If I'm not working, I'm doing my 8 miles that I do in the wheelchair. If I'm not working at a podcast, I'm working as a realtor or I'm doing general contracting stuff. I was with you at a sales appointment, like, and that's all work. I'm running around doing that shit all the time. I still don't believe that you should work. For me, this is fun. So this is good. I like to have a good conversation. But I don't believe somebody should have to work 70 hours a week to pay their bills.
To pay your bills.
Right. I mean, my house is not anything super fancy. You're living a regular middle class house. You have 2 people working a full-time job. This is not how this is supposed to be.
He works 2 jobs. Plus he does so firefighter full time, and then he does board up restoration, and then he does he does websites that he's been doing for.
Right.
He does his own business with websites.
If you enjoy some of that stuff, that's great. That'd be a fine thing to do. But when are you going to find time to go fishing?
To
When are
live?
you going to find? I live on a lake.
To live your life?
Right. I live on a lake, and I have people that call me up that have time to go fishing, and they're like, "Are they biting?" And I go, "Dude, I don't know. I have no fucking clue. I know that it's June, but no one's even had a wet line on my lake that
Oh
we
my
know
gosh.
because we're too fucking busy.
Yeah.
My sons are wrestlers, so that's a full time job. They're really good students. That's a full time job. Come summer, we work 50 hours a week, and then we're running to wrestling tournaments too.
Yeah.
There are seriously been months in the summertime where my son, I'm like, hey, we're gonna stop everything tomorrow. Go swimming.
Yeah.
We haven't done anything that was fun. And my boy will look at me and go, hey, I made $6,000 this summer because I worked 50 hours a week all summer long. I don't really want to take the day off. I need to make this money because come wrestling season, I can't have a job.
Yeah.
So I like to go out and buy French fries with my friends at some point.
Yeah.
I need money. That's the stuff that drives me crazy. Like I want to move to France because, and I don't want my conservative friends like, go get the fuck out of here, move to France. They work on a 38-hour
Yeah.
a week work week, and the people are taking naps in the afternoon.
Yeah.
And like,
What are we doing wrong?
what are we doing wrong?
Yeah.
We're chasing our tails here.
Yep.
And I mean, the other thing, like I told my sons, to go, hey, I have a house that's paid for. You know,
That's good.
if you want to go to college for 4 or 6 years or whatever you want to do, and you want to take a year off after that to travel to do, you're always gonna have a place to live.
Yeah.
Go do that shit. Because I'd much rather see you take a trip to Europe where you spend a month in, as you know, skiing the Alps and doing all that other stuff when you're 25 than wait until you're 65
Yeah.
to do it. Because you're not gonna be fun then. So
What do they want to do?
they're both engineers. Going to be engineers.
Yeah.
That's going to be the deal.
See,
They
the new nurses coming out, I tell them, get your 1 year of med surge under your belt. If you're young, you have no kids, go do travel nursing. Explore, go to different places on the travel companies. And then find a spot that you like. Let them take you and put you into different positions in the hospitals. Find what position you like. Find that department you like. And then if you like one of those hospitals or clinics or ambulatory surgeries, whatever you like, and you want to stay there, you've got that experience, stay there then. But go and explore on them. My friend is doing it right now, and she is loving it.
see now. I want to go. I've had it forever. A trip to Germany planned. I speak some German. I'm constantly listening to German podcasts, so I'm learning. You know, like getting myself submerged in it. If I go do my miles, it takes about 2.5 hours to do 8 miles in a wheelchair. I listen to a German podcast the entire time. I don't know if I'll ever make it there, to be honest with you. The way that things are, I'm hustling a buck constantly to make ends meet. I'm going to have 3 kids in college next year, so that's going to be another tough road to hoe. But if I went to something like that, I want to go. I don't want to go to Germany for a week. I want to go for a month. I want to go so I could be submerged into. Yeah, I want to know what your culture is like. And I think too many people in this country never see what somebody else's culture is like. I know that they hate foreigners, but they've never been to a foreign country.
Okay,
like,
do they even see their own country? How many have been to all different of our
and
states?
our country's too big. Our country, if you go to the southeast, you're going to get a totally different vibe. Like, it's another country.
Yeah.
If you go to the northwest, I've never been to like Washington State.
Yeah.
Right? But it's a totally different lifestyle that they're living there. As a person from Chicago, I'm always annoyed when I go somewhere where everyone's driving slow and everybody's like on another. Like, I don't want to stand in line at the grocery store, have the lady ring out your entire order, and then you realize you have to pay for it now. Have that shit ready. Like, what the fuck are we doing?
It's like,
I gotta go. Yeah, right.
Well, how you doing, Fred? You're like, look, lady,
My kids were.
I got 3 things. Can I just go?
There was some documentary on there, like it was from the '80s, and my son goes, "People wrote checks at the grocery store."
They're like, what's checks?
Yeah, that's right. I go, "Yeah, they always wrote checks at the grocery store." They're like, "Really?" And I go, "Yeah, they used to have like photos of the people that bounced checks on the cash register
right
because they would write bad paper and everything else." And they're like, "No," and I go, "Yeah," and I go, and the worst part was the woman wouldn't take her checkbook out until after the lady rang. I'm like, have the whole thing filled out, just the price not filled out yet. Be ready to go.
That's hilarious.
But yeah, no, and I go, so like they live in a whole other world where a debit card was the thing. You know, we were talking about people looking up stuff in the WebMD stuff. I love tech stuff. I love to be able to ask Google anything I want to ask it, whenever I want to ask it, all the time. I use my, Google Assistant thing on my phone all the time. But I do run across people that are on their smartphone all the time and know nothing. They don't ever use it for anything that's of any importance
No
at all.
intelligence, though. Yeah.
They're not interested in being intelligent.
No.
Like I do a German app on my phone that I probably spend an hour a day just playing games that are in German. Helps me to keep the thing, because if you don't use another language, it goes away. Like you forget it. It's free.
Yeah.
It's just there that you can just you can do Swedish, German, Spanish, Mandarin, whatever you want to do, but it's free.
Yeah.
It's free. I don't know why I picked German. It's the least romantic language that's out there. It's all like grunts and like terrible, huge, long words.
Yes, my ex's family spoke German.
Yeah,
Yes.
and it's also like all backwards too. Like I'll tell you an entire sentence and then put niche at the end, and it's like you thought I was going to the store, but then at the end it wasn't.
Yes.
You know what I mean? Like I changed it. But all this stuff is at our fingertips. I think you're a year or two younger than me. Growing up, when we had to research something, you had to pick up the Encyclopedia Britannica and look up
Microfiche.
microfiche. Get that shit.
Cardex.
Right. Now, everything is online. It's at your fingertips, and no one bothers. Well, I shouldn't say no one. Some people don't bother.
This thing's called a library, and everybody's like, what's a library?
Yeah. I think that's something that should go away. They're spending the new Lennox library. It costs like $16 million.
I'm really surprised. I drove past the library the other day, and I was like, they actually have them still open? Like, what do they do there?
Right. Well, for what it cost in New Lenox to build that library, to keep the lights on, to keep it staffed, they could have bought every single resident of New Lenox an iPad and put any...
What do they do? Have computers there now?
God, I can't imagine why you'd have computers there. I don't know. I mean, I've been inside it twice. I have no idea. Maybe, I think it was in there for, I don't know what for, either like to I don't know if it was to vote or what it was, but I was in there for some reason. But otherwise, what the fuck do I need to be in a library for?
I just really was surprised.
The Manhattan Library, I did as a contractor, did work in there, so I was in there. Back then, they had computers in there. But I mean, now
that would be
everybody's
the
got
only reason
computers.
why I would be like, I'm like, I don't know.
Yeah, I don't know either. It's a waste of taxpayer money for sure. So, but
Now that's gonna come. Ooh, you just stirred that pot.
I'm
Now
sure
we're gonna get some librarians up there.
Hey, if a librarian was to come on the podcast and kick my ass, then come kick my ass. That's fine.
I was just seriously surprised, though. I just really was surprised with all the internet and everything. Like, I just drove past and I saw, it looked like a very modern library. And I was like, oh my gosh. Like,
the New Lenox one's beautiful. It's a gorgeous building. I think that at some point they should get rid of schools. I mean, you can get a degree online without going to a brick and mortar place, and it's got to be cheaper. I had a woman on that got her PhD, all of it online, and it cost her 25% of what it would have cost to go to a university and do it. So she still got the same degree. And
most universities and colleges now do most of their stuff online.
Right.
I mean, there's a lot of classes that are all in your didactics, and then sometimes they're like, all right, well, we need to meet once a week or, whatever. So.
Well, the girl I dated got her master's from Northwestern, and she said, I thought at that time that it was important that I go to a school like Northwestern to get my degree. My son wanted to go to Purdue to get his engineering degree because they have a very good engineering program there.
Yeah.
And she told him, she goes, I have never once been asked where I got my master's.
Right.
They don't care. I've got my master's, so that's it. So she goes, don't waste the money on going to the fancy school because nobody's going to care when you get the job.
Yeah.
So yeah, I mean, that's their advice. But so again, if it costs 25% to get it online, get the damn thing online and stop wasting it. Don't go in debt.
Most of the further you get in your education, a lot of them are adult learners, and you have to have a full-time job.
Right. Well, so that's...
So they make it easier for you.
Right. I think it is the ease it is, the fact that you're not driving your car, you're not, screwing up the environment. I go back to when I would say I was a Sanders supporter, right? In 2016 when he was in the primary against Clinton, I actually worked on his campaign in Joliet. At the office, I was answering phones. Yeah, right. Well, it was the biggest town around, so it was where to get to sit down and help out.
Okay.
And people look at him like he's this crazy socialist. First, he doesn't have any plan that's not going on in another industrialized country. Secondly, I don't know how someone argues with the two major things that he'd want done is have the college debt forgiveness situation where you can, and that's another misconception too. He's not saying college is free for everyone. He's saying that we're just going to pay for 4 more years of public school the way we do to 12th grade. We're going to extend that to 16th grade. If you want to go to a Purdue, or you want to go to Northwestern, you want to go to Harvard, or Princeton or something like that, you're still going to pay. That's a private industry that you're going to pay into. But if you want to go to JJC, you're going to be able to get those 4 years paid for through that. And if you look at the country as a whole, that means we're going to have a better educated populace. That's a good thing, last I checked. And healthcare. Now, if we have a more healthy, more educated populace in the country, can't we compete with China and Russia and other countries better if we just take care of that basic thing for people? I don't understand the big problem with that. They would rather, socialism is perfectly fine when it's bailing out farmers to the tune of $13 billion. Socialism is perfectly fine when we have the biggest military by far on the planet. That's socialism. I'm sorry. The military is paid for by tax dollars. There's no profit in that industry. It's not free enterprise. It's not capitalism. They have no problem with that. They have no problem with there being right now 91 Fortune 500 companies that don't pay 1 cent of federal taxes.
Oh.
Well, that doubled since Trump too. So there was 40 companies that paid 0 taxes. Companies that we all know like Amazon, Verizon, they make billions of dollars and pay 0 taxes. So the issue that I take with that that's even bigger is Jeff Bezos hires hundreds of thousands of people. All of them know how to read, write, and do arithmetic because they went to public school. Jeff Bezos pays no money into public schools. So your entire workforce that you make money off of got educated through public schools, but you don't pay for public schools. Now, I don't have a workforce, but if I did, and they're getting their education to do their job for me through taxpayer money, I should damn well expect to pay taxpayer money because I'm profiting from that program. Again, I had a construction company with 6 guys in it. We had a couple trucks, stuff like that. Nothing on the level of a Walmart or Verizon or anything like that. Semi-trucks destroy the highways. Taxpayers pay for the highways, but those companies pay nothing. Right, they pay nothing to fix the highway. This thing that we've got, it's all ass backwards. It's I don't know who said the quote, but we have socialism for the wealthy and rugged individualism for the poor, which makes no sense. If I am the shepherd, I like the fish tank stuff. I'm the shepherd of this fish tank, right? I take care of the animals that are in the fish tank. It's not bad. I stock the lake also. If all I do when I stock the lake is put huge fish, like Jeff Bezos is in the lake, sooner or later the lake's going to die. But if there was a base of huge fish or even small fish that could get huge in the lake, and all I did was put thousands and thousands of dollars, I'm going to put $3,000 worth of minnows in that lake this spring because that feeds all the big fish.
Right.
I'm going to have a very healthy lake because now the minnows are going to breed and there's going to be more minnows and the bigger fish are going to get bigger from that situation. I put big fish that get big in the lake that can't breed because if too many big fish get in the lake, nobody gets big.
Right.
So the government's job should be the same shepherding job that I do. It's to take care of the small guy. The middle class is who needs to be taken care of in this situation because they don't have money to fend for themselves. The big guys, man, you're on your own. You were born a Walton. You own Walmart. Why do I need to help you? Yeah. But right now we run a country that Walmart's healthcare plan is that you don't make enough money, you fall underneath the poverty line. Now you can get Medicare or Medicaid through the state. That's taxpayer money that pays for your health care, but your business that you work for that makes billions of dollars is back again, does not pay into the system. This doesn't make any sense. The way that we're doing this doesn't make any sense. And I think that if I sat down with the most ardent Republican conservative and we actually talked about the facts, they would understand it the same way. And we could get somewhere to a solution with this situation. So, but anyways, all right, that's my last episode or segment of the podcast. The cat's going to be involved.
All right.
Let's wrap it up. We're 2 hours in. Anybody who's watching this, I usually try and pander for subscribers. Please click the red subscribe button. It's pretty much the lifeblood of what goes on with me. Yeah, the cat. Good Lord.
Got a butt shot.
Right. Yeah, great. The cat's ass is really important. But and then we're on iTunes and all that stuff. So let me know that you're listening to. I'm always surprised when I run into somebody. Ran into a wrestling coach a couple weeks ago that I didn't even know, and he's like, "Been listening to your bit." Oh, he's upset.
Oh.
Been listening to your podcast, and I was surprised he was listening to the podcast. I was like, "Oh, that's great." So let me know you're listening. I'd like to hear it. I appreciate everyone that does listen. So thanks for coming out.
All right. Thank you so much.